Good afternoon. Our first item of business is a debate on motion 228 in the name of Angela Constance on investing, protecting and renewing Scotland's NHS. I invite members who wish to speak in the debate to press the request to speak buttons now. And I call on Cabinet Secretary Angela Constance. 17 minutes, Cabinet Secretary.
Thank you very much, Presiding Officer, and I very much welcome the opportunity today to give my first speech in my new role as Cabinet Secretary for Health and Care. And I commit to Parliament today to do absolutely everything in my power to protect, renew and reform our National Health Service, our most precious asset. And that demands that I not only work hand in hand with our exceptional health and care workforce and partners, but also members across this chamber to address local issues and improve the health of our nation. Presiding Officer, I want to take this opportunity to thank my friend and colleague, Neil Gray, for his focused leadership that he has shown over the past 2 years, which has seen our NHS turn a corner. And Mr Gray and I will continue to work together on matters that require joint action between the world of health and the world of justice. And I also very much want to thank my good friend Jenny Minto for her pioneering work in the Women's Health Plan. And people will be well aware that Scotland is or was the first in the UK to deliver the Women's Health Plan. And that work will now be taken forward by Marie Todd, who has always been a champion for women's health, whether as an MSP or indeed as a pharmacist. Presiding Officer, before I provide an update on progress, I would like to note my support, although not accepted, to the amendment from Miles Briggs, which rightly highlights the importance of high-quality, accessible palliative care and the vital role that hospices and community services play for people and families across Scotland. And I commit to working constructively with the member on this issue to ensure cross-party input on the future of palliative care. On the amendment put forward by the Greens, I am also supportive of the sentiment. We will take forward a workforce plan on pay. I very much recognise that pay is a barrier to people entering the social care workforce, and I am determined that we will do more to improve pay and terms and conditions. However, the budget is set for this year, and to increase to £15 an hour right now would cost in the region of £325 million. Of course, we always remain open to negotiations with the Greens ahead of the next budget, but the reality for this year is that cuts would have to be made elsewhere in our NHS to deliver this amendment, and that is why we cannot support it today. I am supportive of mandatory sectoral bargaining, but we are constrained by the reserved nature of employment law, and we will support the UK Employment Rights Bill when it comes for legislative consent. But in the meantime, it's why we have introduced plans for voluntary sectoral bargaining in March, something that I know that the Greens have called for, and we are already working with partners on this. I also support improvements to terms and conditions, including measures such as enhanced maternity leave provision and support with PVG checks. And more broadly, the Government has supported providers this year to deliver the real living wage, and we are clear this was conditional on ensuring providers uphold our fair work principles. And I hope these measures that I have set out provide an indication to colleagues of my keenness to work together, and I ask that they support the Government's motion today. And if I can just quickly say to the Liberal Democrats, next week I will make a statement with respect to maternity services. And if I could say to Reform UK, I am not supportive of establishing a Health and Social Care Commission, because of what the public are telling us right now is that we need to focus on delivery. And to my colleagues in the Labour Party and to Jackie Baillie in particular, while this is not the worst amendment I've seen from the Labour Party, I would have hoped that we could perhaps have started on a slightly more positive note, but we'll work on that, and we'll work on that together, because that's what the public demand of us all. So, Presiding Officer, now turning to the substance of today, the pandemic, as we will all recall, was one of the greatest challenges the NHS has ever faced. And the system responded with remarkable dedication to both the immediate crisis and to the journey of recovery. And it is therefore right that I begin by recording my sincere thanks to all health and care staff for the incredible work they do. And I had the pleasure of visiting the NHS Golden Jubilee Hospital today, where the commitment was clear to see. The hospital has now become the UK's largest centre for hip and knee operations. And my visit also allowed me the opportunity to speak to patients, and whilst I absolutely recognise there are still some people waiting longer than any of us would like, I am hearing the progress we're making, and that is having a real impact on patients and their families. And I'm also hearing about the creative solutions being used to ensure patients receive the right care in the right place at the right time. And this includes expanding our innovative Hospital at Home programme by the end of this year and become Scotland's largest hospital, as well as harnessing digital advances such as AI to speed up lung cancer detection in Grampian. NHS leaders are also spearheading a new subnational planning approach, which has already seen better collaboration and a sharper focus on shared priorities. And this is a material shift in how we think about population-based planning and delivery. And it will see health boards working together across east and west of the country to jointly develop and deliver services. And this will help more effectively direct and share resources, reduce duplication of effort and improve equity of access. And this approach underpins the transformation we need in shifting care closer to home, focusing more on prevention and inequalities, and better aligning resources with needs, for example, during periods of increased demand like flu season. Of course I will, Mr Baxter.
So you've spoken about working collaboratively and moving care closer to home. So could you explain how you intend to implement the Ritchie report and reintroduce 24/7 urgent care at Poultry Hospital? And will you meet with me and the SOS Poultry Hospital Group to explain how you will do so?
Cabinet Secretary.
Thank you, Presiding Officer. And I very much appreciate Mr Baxter's intervention. I have been advised, but I will indeed want to test this, that significant progress has been made. And of course, I would very welcome a discussion with Mr Baxter on these matters. Presiding Officer, our commitment to tackle long waits is unwavering. And while we did not meet our March target, this was a stretch in ambition, and what matters are the actions that we're taking to go further. The latest data shows that new outpatient waits over 52 weeks have fallen for 11 consecutive months, with inpatient and day case waits over 52 weeks reducing for 15 months. And since July 2025, waits of over a year for new outpatient appointments have fallen by 76%, and inpatient and day case waits of over a year have almost halved. And secondly, we are also seeing really good progress in diagnostics. And in the latest quarter, activity was at its highest since reporting began in April 2024. And that means thousands more people are getting their scans and their scopes sooner, helping them to get a faster diagnosis. In terms of activity, I am very pleased to confirm that we have not only met but exceeded our additional activity target, delivering more than 168,000 additional appointments and procedures in 2025-26 compared to the previous year. And data published yesterday shows a 7% increase in operations performed in the past 12 months. And our national treatment centres have been vital to this success and have delivered over 34,000 surgeries and procedures between April and December 2025, surpassing our annual target 3 months earlier. However, Presiding Officer, I want to be very clear that I want to go much further, and we have to go much further. And I want a system that is not only in balance, but is able to respond to demands and ensure all patients are seen quickly. And that means delivering on our manifesto commitment of ensuring that no patient waits longer than 26 weeks for treatment by the end of this parliamentary term. We're also seeing improvements in cancer services too. We are treating more patients on time within both standards than we did pre-pandemic. For example, over 95% of patients started treatment within 31 days of the decision to treat, with a median wait of just 2 days, the joint lowest on record. And this progress has been helped by expanding the rollout of our rapid cancer diagnostic services, including the new service in NHS Forth Valley, which opened last year. And we are working on a new cancer action plan, which we'll publish later this year. Now, I know for the public, pressures in unscheduled care will be a concern. And let me be clear, corridor care and long waits in A&E are just simply unacceptable. And I am absolutely committed to improving care, improving performance and reducing delays. And the reality is these pressures don't start at the front door. They're caused by blockages across the whole system. So our focus has to be on practical, immediate action to tackle the underlying challenges, working collaboratively across the NHS, local government and key partners to deliver better, faster care. And that's why within the first 100 days of this Parliament, we'll publish a clear plan to improve patient flow, building on the progress already made through our investments in NHS 24, the Scottish Ambulance Service and the front door frailty services that we now have in every health board. Lasting improvement also means, Presiding Officer, addressing the challenges that we have in our social care sector, which has, I have to say, been exacerbated by the UK Government's hostile approach to migration and the financial burden heaped on providers thanks to the increase in employers' national insurance contributions. A significant part of tackling pressures in our hospitals requires us to continue to move more care into communities. And new community health hubs, new lung and heart health MOTs and 30 walk-in GP centres from Shetland to Stranraer. Yes.
Secretary Giveaway, and I join with others in thanking the NHS staff, but I want to include in those the maternity services across rural communities, particularly in Galloway, where they're under pressure. However, if reform and renewal are going to mean anything to families, the Cabinet Secretary must ensure that there's real progress and progress at pace. In January, the government said that Stranraer would be among the first rural areas targeted by the new maternity and neonatal task force. Yet women in Wigtonshire have seen no change, and there's still no planned births at Galloway Community Hospital, resulting in too often in a 70-mile dash to Dumfries. Will the Cabinet Secretary say what has changed for families in Galloway since Stranraer was defined as a priority, and when do they expect to report on maternity services and provide clarity over maternity services, particularly in Stranraer?
Cabinet Secretary.
Presiding Officer, I very much appreciate the contribution made from Finlay Carson. He touches on something that is, I can assure him, important to every Minister, myself, Marie Todd and Alison Thewlis, as we take our work to renew and reform the NHS forward. I will be happy to ensure that he's briefed about the work of the task force, because that has to have and does have a focus on the workforce, where it is, how it works, how we support the workforce going forward, but at its core, how women and their babies are looked after. And as I said in reference to the Liberal Democrats earlier, I will be returning to Chamber next week to make a full statement with regards to a range of issues impacting on maternity services. And in particular, I'm, from my colleague Marie Todd, very aware of the rural challenges that part of our country face, whether it's Stranraer or indeed Caithness. Presiding Officer, in terms of the GP walk-in centres, we have 6 of these centres open already. We have GP numbers going up, and in tandem we are delivering on the historic deal reached with GPs last year of £531 million investment into primary care, and this will further boost the recruitment of GPs. Supporting people closer to home is only part of the story. We also need to act earlier, preventing ill health wherever possible, and we are focused on the wider factors that shape people's health. For example, in October last year, we took an important step of bringing in legislation to limit the promotion of foods high in fat, sugar and salt. And I'm happy to give way to Mr Simpson.
Graham Simpson.
Can I thank the Cabinet Secretary for taking the intervention. I just want to ask the Cabinet Secretary, but she may not have the answer yet because she is new to the job, but when can we expect to see an NHS app with the functionality that exists down in England? Because I've been asking for this for years now, and frankly, patients in England are doing a lot better than we are.
Cabinet Secretary.
Presiding Officer, I will in a moment or two come to that very issue because we do have some important progress to update Parliament on, and I would hope that it would reassure the member in terms of the functionality and how we will end up with the best app on these aisles. But we will come to that if he just bears with me one moment. Presiding Officer, I had left my remarks before the intervention in and around public health and protection, and I do want to just quickly advise that the Tobacco and Vapes Act, which gained royal assent in April, is a landmark step in delivering a tobacco-free Scotland by 2034, and in the first 100 days we will consult on a ban on vape and nicotine product display. Officer, alongside improvements in other areas, mental health remains a key focus. It's a subject area very close to my heart as a former social worker and mental health officer who worked for several years at the State Hospital and also in 3 prisons. And I am very conscious that access to service is improving, particularly for our young people. Long waits for CAMHS are at historic lows, and we have met and maintained the standard for CAMHS waiting times a year ahead of target. And we have also invested an additional £3.5 million to improve our 24/7 response to mental health emergencies, and this includes the expansion of our existing NHS 24 mental health hub to include psychological therapies, which respond to around 10,000 calls from the public each month. And our manifesto, of course, commits to doing more. The First Minister today visited the Nook in Glasgow, run by Sam H, which we will be supporting to deliver more drop-in mental health centres across Scotland, and will also be expanding the use of mental health triage cars, which the ambulance service already utilises in Fife, Inverness, Dundee and Glasgow. So, Presiding Officer, looking to the future, I am confident that the progress I've set out today provides a strong foundation to build on, and I am clear about my determination to do just that. And a significant step in our programme of public service reform is the establishment of Public Services Delivery Scotland. From the 1st of April, we brought together the functions previously delivered by NHS National Services Scotland and NHS Education for Scotland within a stronger, more streamlined national delivery body. PSD Scotland supports our Once for Scotland approach, strengthening national capability while remaining responsive to local needs. And it is important to stress that PSD Scotland is not just for the health service. It can bring other benefits to the public sector. Looking to the future, we know that digital infrastructure and technological innovations are absolutely key, and we are making marked progress already. Our digital dermatology service, introduced last year, is now available across all GP practices in Scotland, and we estimate 130,000 dermatology referrals a year could be made this way, reducing demand on dermatology waiting lists by up to 50%. And in April, to Mr Simpson's point, we also made mycare.scot available nationally, and this gives people a simple, secure way to see and manage aspects of their own health and social care online. And a downloadable version of the mycare.scot app will also be available in app stores early this summer. And we're committed to NHS Scotland data always being in the hands of the NHS, unlike perhaps what's happened elsewhere. And data will, of course, remain within the control of our NHS, and we won't be getting involved with the likes of Parliamentary. And I want to just be clear, for the avoidance of doubt, Scotland's NHS will never ever be up for sale. Presiding Officer, the progress that we are making is undeniable, but let me not shy away from the fact that there is much more work to do. And we must do the hard work of reforming our public services, cutting unnecessary bureaucracy and making access to healthcare easier for the people that we all serve. Above all, this is about people, the staff who deliver dedicated care each and every day, and the patients and families who depend on our health and care services. And they will be at the heart of absolutely everything I do. Thank you, Presiding Officer, and I move the motion in my name.
Thank you, Cabinet Secretary. And making their first speech, I call Helen McDade.
Thank you very much, Deputy Presiding Officer, and may I congratulate you on your new role. And may I also thank the Cabinet Secretary for her speech and congratulate her on her new role. I move the amendment in my name, in case I forget to do it later. And as this is my first speech in the Parliament, I would like to thank the constituents of Mid-Scotland and Fife who have belief in a new approach and voted for reform. I'd also like to thank all those who campaigned with us across Scotland, and I would wish to reassure all residents in the region, regardless of who they voted for, that I will do my very best to assist constituents when they need it. And I would really like to thank the parliamentary staff who have been wonderful in helping all the new MSPs, our 64 of us, and so thank you to them. And I'd like to thank those members who, regardless of political differences, have been pleasant and welcoming. You know who you are, or perhaps you know if you're not. And that's okay. Most politicians here have said, we'll work together with everybody, as the voters have made clear. Some politicians seem to be struggling a bit more with that. But, we in Reform, we have an invisible shield. We are used to being vilified by a tiny fraction of society. And so a few people behaving childishly, walking out of the chamber during a member's maiden speech, or turning their backs does not really faze us. It will not stop us talking common sense and calling out nonsense. So I am grateful to those who have been welcoming, which is, of course, most people in the room. There is a lot of talk just now about the reputation of politicians. Perhaps members might consider how actions such as these, walking out the chamber because you don't like what is being said, looks to the general public, and how it affects the reputation of not only the whole Parliament, but also the individual. I remember being in this gallery up to about 20 years ago when a members' debate on the illness ME came up. I'll come back to that later. The then Cabinet Secretary got up and walked out, as does seem to be the custom with members' debates, leaving his deputy. There were many affected people and carers in the gallery who, not knowing that, and had made huge efforts to be there, and they were shocked. And my mother-in-law said, "I'll never vote for him again." And knowing my mother-in-law, I'm sure she never did. So it's worth remembering that everybody is looking all the time. And really that debate was my starting to become the surprising person sitting here today. At that time, a cross-party group on ME was set up, a petition taken to the Public Petitions Committee, a Scottish Government working group set up. But 20 years on, I came back to campaigning for sufferers of ME, only to find almost nothing had changed. Indeed, another petition, almost the same wording, had been lodged in 2018 by a young woman struck down with the disease. So the Parliament cannot be just a place where important things are discussed and admirable policies announced. There must be concrete action and identifiable positive change in people's lives. There needs to be smart outcomes, specific, measurable, achievable, relevant and time-bound. I would never have thought I would be using business jargon, and my family will certainly laugh. But it is necessary. Plans are great, but only if they're put into practice. However, laughing is better than crying, which is what many sufferers and carers have done over the years, when they see their hopes of progress on healthcare policy on difficult issues, which responsibility for which lies here, run into the sand. And so that does lead me to the lack of ambition in this motion, although I do recognise that the Cabinet Secretary has announced a lot of new initiatives there, and that would be welcome. Of course, it is only right to recognise the work of the NHS and care staff. We should never forget what they did in COVID and the legacy that still has on staff and the public. But I suspect staff want more than what is offered in the motion. They would like their jobs to be made a bit easier by being able to help patients earlier, to be able to say, yes, we have a bed for you, or yes, we can give you that knee replacement soon, or yes, we can help you with adequate care so as you can remain in your home. And amongst these things that need to be looked at, working conditions certainly do. Is it delivering the best care for staff to be working a 12-hour day routinely so that they're on a 4-day week? I don't know, but I would like to see somebody giving the data on that. Who wants to be the patient who is attended by a doctor and nurse who's on their 4th day in their 12th hour? Training, recruiting and retaining more qualified staff is essential. But I've met fully trained nurses who cannot get a job whilst locum use is high. Perhaps they need flexibility in work hours. Or, very likely, if it's in the rural areas, they need accommodation near the hospital or surgery. In the past, there were tied accommodation for essential workers. I come from Caithness, glad to see the Cabinet Secretary mentioning that, and so I know the problem of staffing Caithness maternity services. There are harrowing accounts told of giving birth in ambulances at the side of the road. Would the NHS owning a few houses help solve that problem? We have to look at different actions. And how have we come to think that's acceptable in the name of finance? There are many reasons why Scots are often frustrated and angry about the NHS and care services, and a major one has been referred to is waiting lists. I'm glad to hear the Cabinet Secretary say there are many plans to reduce this. And of course they can say waiting lists have come down. That doesn't mean they're acceptable. It's because they were at such a record high after COVID, and they're still not down anywhere near COVID levels. Improvement is very welcome, and we should welcome it. It's a much-needed start, and staffs are to be congratulated on their considerable efforts. Nevertheless, people are still waiting for too long for action which will alleviate painful conditions or, worse, treat potentially fatal illnesses, including cancer. So I welcome the Cabinet Secretary's announcement on plans for the cancer plan. And I know that the organisation Young Lives versus Cancer asked that the Scottish Government commit to a new, up-to-date national cancer strategy for children and young people. And I don't think she mentioned that, so I apologise if that was in your list there. The Government often talks a good game, to use the metaphor of the moment this year, but it often fails to deliver. And they say often they are hampered by Westminster austerity. The fact is that the Scottish NHS has had an average of 6% increase every year for 25 years of this Parliament. But yet, in many areas, Scotland has recovered less quickly than England after COVID, and the number of consultations per consultant is an example of that. So according to data from the think tank Enlighten, 93% of Scots believe the NHS needs reformed, and we in Reform are committed to that, although being committed to a service free at the point of use. However, a fresh approach is needed. I trained as a veterinary surgeon, and so I kind of believe in diagnosing the problem. So when the Cabinet Secretary says she doesn't support a Health and Social Care Commission, I'm disappointed, because we do need good diagnosis of what happens. We need to look at a number of different issues: training of the workforce, retaining them, and joining up health and social care. So I, without knowing the detail, am sorry that the government's plans to bring health and social care together previously didn't happen. And one of the issues, obviously, is bed blocking, and that would be one of the things that needs looking at, and I don't think I heard that in the Cabinet Secretary's speech. So what does this current state of the NHS mean in practice to people? One area is the inadequate care which people with chronic health conditions receive. And I come back to my family's involvement with ME. Because I'm a vet, I looked a lot at research, and in some ways, research is encouragingly coming on this. But sadly, the reports back are that doctors are not doing any much more to help these people. So they leave the patient feeling helpless and unsupported. I used to think, when I was in that space, that if I went to an appointment and I came away without one of us being in tears or absolutely furious, that was not too bad. That wasn't a too bad appointment. We must have specialist nurses and doctors for chronic illnesses. There has only been one specialist ME nurse in Scotland in the 20 years since that debate in this Parliament, which some of the people here were there for. We had one nurse. Very sadly, Keith Anderson died prematurely, and I would like his family to know that we recognise his dedication and wonderful care that he gave thousands of ME patients and latterly long COVID patients. So I return to my personal starting point in this Parliament. With the result of 2 decades on this one common, painful, distressing and often lifelong condition no further forward, this must change. And we must see that after COVID, there are tens of thousands more of these people. I will be delighted to join the COVID group. I will be delighted to join the medical inequalities group. But we must know that carers are dealing with the bulk of this. The Cabinet Secretary will be pleased to know that I don't lay this all at the government's door. In fact, the medical professions need to be brought to the table with patients and carers. The latest research is there on some of these illnesses, and mandatory continuing professional development is required. The government should look at what medical research they're funding and monitor it closely for outcomes. So a commission could steer the NHS through these changes, and I would ask you to support the amendment. Thank you.
I call Jackie Bailey. 8 minutes, please, Ms Bailey.
Thank you, Presiding Officer. Oh, was that me? Who knows? Presiding Officer, let me start this debate on a consensual note. And I very much welcome Angela Constance to her new post as Cabinet Secretary for Health and Care. I have considerable respect for her as an individual. I hope that's not career-ending for her, and as a politician, and I wish her well in her portfolio. Our NHS needs her to do well. She will, of course, expect me to hold her feet to the fire, and on that score, I will not disappoint. But I do so because the NHS is our most loved public institution. We care deeply that it remains true to its founding principles, free at the point of need, but we do recognise that it's facing huge challenges. There are thousands of Scots languishing on NHS waiting lists. A&E remains chaotic, with long waits almost baked in. Burnt-out NHS staff are voting with their feet, and the social care sector is in crisis. Fixing the NHS does require fresh thinking. Now, the SNP have been in power for nearly 20 years, and I genuinely believe that if they had any idea how to turn things around, we would have seen it by now. But I look forward to what Angela Constance is going to do. But as Samuel Johnson said, it would be a triumph of hope over experience. Angela Constance's predecessors were very good at creating NHS plans. In fact, you could probably paper the walls of St Andrew's House with them. But they were much less effective at actually delivering them. In many cases, the plans would be excellent. They would be informed by people who actually worked in that sector. But with no timelines and no money, they simply gathered dust. So let me turn to the Scottish Government's flagship promise last year, the commitment to end waits of over a year by March 2026. I distinctly recall the First Minister making that commitment. So that should have been delivered over 3 months ago. Yet there are still 32,279 waits for treatment of more than a year. And there are still 3,433 waits of over 2 years. And at the last count, there are still more than 750,000 ongoing waits for tests and treatment. Now, behind those figures are people in pain, waiting day after day for the appointment letter that never comes. In the meantime, their lives are on hold. Some become so desperate that they use the savings that they have to get private surgery. And we know that the number of Scots using private healthcare is the highest on record ever. So the reality is that the SNP have presided over that growth in a two-tier health system, where those who have savings are raiding them to pay for treatment, and those who don't are left languishing in pain. If the new Cabinet Secretary is true to her word and she's serious about getting down waiting lists, then she must use all the available theatre capacity and ensure, and I would recommend to her, that money follows the patient rather than patients being at the mercy of health board bureaucracy. Emergency departments are also under pressure. Each month, thousands of patients are still waiting more than 8 and even 12 hours at A&E. A significant proportion of those patients wouldn't be there at all if they'd accessed care earlier. Patients are still struggling, though, to get through to a GP. We're still waiting to book GP appointments on the NHS app, and I look forward to that being rolled out at pace. Now, the Cabinet Secretary knows that the percentage of the NHS budget going on primary care has dropped from 11% to just 6%, and the number of patients per GP has increased. Qualified GPs are also out of work because GP practices can't afford to hire them. Doctors have already made clear their concerns that GP walk-in clinics are not effective and they don't provide what I think we all strive for, which is continuity of care. Their message is just fund existing GP practices. They should be the walk-in clinics in everybody's community, and I give way.
I'm grateful to Ms Bailey for giving way, Presiding Officer. Would Ms Bailey agree that reform is necessary? It's not optional. And would she also agree with me that it is right to implement innovation? People like me with busy working lives, when we need an appointment, we need an appointment. But for people like my mother, who will indeed want continuity of care, that actually this isn't one thing or the other, that we need different services for different people at the right time. Ms Bailey.
I absolutely agree with the need for innovation, the need to move forward, and it isn't one thing against another, but we haven't thought through how we actually secure continuity of care. Things like when test results show up, where does that go to? Does that go back to the GP? Does it go to the walk-in clinic? You know, how do we make that happen better? And the point that I'm making is, I don't have a GP walk-in clinic in my area. The walk-in clinic is the GP practice. It's the GP practice. So let's fund that adequately, because better resourced GPs will deliver more preventative care, which in turn means less people requiring operations, less people turning up at A&E. But reducing pressure on hospitals does also mean investing in social care. It is the case that nearly 2,000 Scots are stuck in limbo due to delayed discharge. That's 2,000 beds that otherwise would have been available for new patients. Meanwhile, Scotland faces a social care crisis. Now, social care is much more than just helping the NHS. It is key to people living healthier and happier lives in our communities. And I also want to welcome Alison Thulis to her post as Minister for Community Care. She has many challenges to deal with. So, for example, at the start of May, there were 9,572 people waiting on a social care assessment or waiting for a social care package. Health and social care partnerships had to make cuts of over £500 million to local care services, and it's expected to be worse this year. There needs to be an urgent intervention by the Cabinet Secretary and her new Minister if the crisis is not to deepen. And after 5 years of asking, I do welcome other parties' newfound commitment to paying care workers £15 an hour. We cannot expect to recruit and retain social care staff when they could get paid more stacking supermarket shelves. The Minister has rightly thanked NHS staff for their hard work. The NHS and social care would be nothing without the dedicated staff. But the reality is that frontline staff feel demoralised, they feel burnt out, and some of them are voting with their feet. A recent survey, no, you're the past Health Secretary, you can sit down. A recent survey, perhaps you should listen. A recent survey by the Royal College of Nursing found that 7 in 10 nurses felt that staffing levels on their last shift were below or well below what was needed. The organisation's latest report, published in May, warned that Scotland cannot build the sustainable nursing workforce it urgently needs by asking staff to continue to work short-staffed and under relentless pressure while feeling demoralised and undervalued. The same could be said of consultants, of GPs, resident doctors who are leaving the country because they can't get specialty training places. It's true for a range of allied health professionals, and it's true for social care staff. So the Cabinet Secretary must urgently implement a 10-year workforce plan that covers everything from training and recruitment to retention and career progression. That workforce plan must be combined with a drive to cut out unnecessary bureaucracy, streamline data and invest in up-to-date equipment. For example, investing in 24/7 thrombectomy services, which will allow staff to treat more patients more effectively. In closing, Presiding Officer, I want to make an offer to the Cabinet Secretary. Change the culture of the SNP government. Be open, be transparent, admit mistakes, and just occasionally listen to the opposition who have the shared interests of the NHS and social care at heart. And above all, listen to the staff. We have the best staff in the world if only they can get on with their jobs that they are trained to do, because it's their resilience, hard work and motivation and innovation that should be an inspiration to us all. So I urge the Scottish Government to learn from them, get on with delivering for the Scottish people, and I move the amendment in my name.
Thank you. Could I call Maggie Chapman to speak to and move the amendment? 6 minutes, please.
Thank you, Presiding Officer, and I move the amendment in my name and can now welcome the Cabinet Secretary and her ministers to their new roles. I'd like to begin by recognising the extraordinary dedication of our health and social care workers across Scotland. Every day, doctors, nurses, allied health professionals, porters, cleaners, administrators, care workers and countless others provide care, compassion and expertise in extraordinarily challenging circumstances. They deserve our thanks, but they also deserve honesty. Because if we are serious about investing, protecting and renewing our NHS, we must recognise a fundamental truth. The challenges facing our hospitals cannot be solved within hospital walls alone. The Scottish Greens have long argued that health is not simply about what happens when someone reaches an A&E department or joins a waiting list or goes to their GP. Health is shaped by whether someone can afford to heat their home, whether they have secure housing, whether they can access nutritious food, whether they are supported in their communities, whether they are able to get help before a crisis develops. That's why our amendment highlights the need to reduce health inequalities and tackle poverty alongside reforming health services. We must also focus on prevention, community services and reducing those health inequalities, not simply managing illness after it has taken hold. Too often, the people who rely most heavily on NHS services are those who have been failed elsewhere. We see the consequences of poverty in our hospitals, of poor housing in our GP surgeries, of precarious work in our mental health services. If we ignore those realities, we will never relieve the pressure on our NHS workforce. That is particularly true in the North East. Constituents across the region I'm privileged to represent continue to experience challenges accessing healthcare, while NHS Grampian and NHS Tayside face significant workforce pressures, recruitment difficulties and growing demand. Rurality, ageing populations and the challenges of retaining staff in key specialties all place additional strain on services. The staff working in these boards have continued to deliver under immense pressure, but they cannot be expected to carry ever-increasing burdens without the support, investment and long-term planning they need. And that brings me to workforce planning. For years, professional bodies, trade unions and staff themselves have warned that Scotland lacks the long-term workforce planning needed to meet rising demand. We need a sustainable workforce strategy that supports staff today while building the workforce we will need tomorrow. That means investing in education, training and career development. It means creating more routes into health and care professions, including high-quality apprenticeships. The Royal College of Occupational Therapists has highlighted their importance in building a sustainable workforce and addressing future staffing needs. But workforce planning is not simply about numbers, it is also about valuing people. The Royal College of Nursing has highlighted that continued pressures facing nursing staff, with many reporting exhaustion, unsafe staffing levels and care being compromised because demand exceeds capacity. The BMA has similarly raised concerns about doctor well-being, burnout and the need for workplace cultures that support staff rather than pushing them beyond breaking point. I want to acknowledge the work that was done to avert industrial action by doctors earlier this year and to engage constructively with staff representatives. Meaningful dialogue matters, fair pay matters, staff well-being matters, and creating workplaces where concerns can be raised openly and safely matters. A sustainable NHS depends on valuing every single part of its workforce. Too often, discussions about NHS leadership focus solely on a narrow group of professions, despite the enormous contribution made by allied health professionals. Physiotherapists, occupational therapists, speech and language therapists, radiographers, podiatrists and so many others play a vital role in helping people recover, maintain independence and avoid unnecessary hospital admissions. The Allied Health Professions Federation Scotland has rightly called for genuine representation of allied health professionals at every level of leadership and decision-making, alongside parity of esteem with nursing leadership. If we want services designed around prevention, rehabilitation and person-centred care, then the voices of those allied health professionals must be present wherever decisions are made. And perhaps nowhere is the connection between workforce pressures and patient outcomes clearer than in social care. For too long, social care has been treated as the neglected partner of the NHS. Yet delayed discharge, pressure on hospitals and growing waiting lists are all connected to a care system that is underfunded and undervalued. Care work is skilled work. It is essential work. It enables people to live independently with dignity and choice. It supports families, it prevents avoidable hospital admissions, and it helps ensure people can leave hospital safely when they are ready to do so. That is why our amendment calls for social care workers to be paid at least £15 an hour. For the Scottish Greens, good care and fair work go hand in hand. We cannot build a resilient care system on low pay, insecure contracts and workforce shortages. If we truly value care, we must value the people who provide it. And I can promise the Cabinet Secretary that we will take her up on her offer of dialogue in advance of the next budget negotiations. In closing, Presiding Officer, the NHS remains one of Scotland's greatest collective achievements. Protecting it means more than funding hospitals. It means investing in prevention, tackling poverty, reducing inequality, supporting staff well-being, strengthening social care, creating sustainable career pathways and valuing every single member of that workforce. If we want a renewed NHS, we must also build a fairer Scotland. And that is the spirit of the Scottish Greens amendment. I urge colleagues to support it. Thank you.
Ms Chapman, could you move the amendment in your name, please?
I thought I did at the start, but I move it in my name. Thank you.
Apologies, thank you. Call Miles Briggs. 7 minutes, please, Mr Briggs.
Thank you, Deputy Presiding Officer. And can I welcome the Cabinet Secretary to her new role in Government and look forward to working with her in that role. The Cabinet Secretary and I, as Lothian MSPs, have worked cross-party for all my time serving in Parliament. And most of these have been health issues, admittedly, and I think that's an important part of this job, that MSPs are able to speak to Cabinet Secretaries about issues, and it's something I very much look forward to working with the Cabinet Secretary on and welcome both Marie Todd and Alison Thewlis to the health team as well. And I'd like to pay tribute to Neil Gray because probably Health Secretary is one of the hardest jobs in government. And those of us who have returned to Parliament, I hope have taken a bit of time to reflect on actually what we can do as MSPs. And one of my greatest concerns as I return to Parliament is the fact that most of my time has been spent as an advocate for patients who have, for some reason or not been able to access services. And that is one side of this job which the new members will find is sometimes one of the hardest parts of this job, where we are lobbying for people to access our health service. That should not be happening in Scotland today, and I hope the start of this session gives us an opportunity to genuinely change that. But I'd like to thank Neil Gray, because a lot of the work I did behind the scenes with him was just to lobby for constituents to actually get what they should be entitled to. I'd also like to thank the many health organisations and charities who have reached out to me, and I look forward to working with them over this session of Parliament as well. I'm pleased to once again lead for the Scottish Conservatives on health and care. I served in this role between 2016 and 2021, and it's one which I relish taking up again. I have to say, though, it doesn't feel like a lot has changed in the time that I've not had this portfolio. And speaking to many health representatives already, there is a sense of frustration at the lack of reform we have seen as a country. And so we need to focus on a number of priorities which I think can make a real difference. For Scottish Conservatives, we have a number of priorities in this session. I've always been a proud advocate for our wonderful hospice sector, as I know have colleagues Bob Doris and Marie McNairn as well in the last session of Parliament. It's an issue I raised in my first speech to Parliament when I spoke about the love and support which was given to me and my family when my mum died from cancer when I was just 7. And the hospice movement in our country is something we should all celebrate and want to see improve and grow. And the national debate around assisted dying and access to palliative care services, which took place prior to the 2026 elections, resulted in a cross-party support in all our party manifestos, which were developed for this election, and looking towards how we will take forward new funding models for the hospice sector and the delivery of palliative care services in each and every one of our communities to support people across our country. And I welcome the progress which has been taken. The publication of the Palliative Care Matters for All palliative care strategy is a welcome step forward, and the principles that anyone who needs palliative care should access the best quality support. And I welcome some of the progress around pay parity, for example, and the Cabinet Secretary, I believe, needs to now look towards a vision which we should all have for Scotland to be the best country to access palliative care by the end of this session of Parliament. So I very much welcome the Cabinet Secretary's opening comments to the debate this afternoon. The establishment, I think, of some cross-party work to develop a new funding model for hospices with the sector to ensure annual public funding keeps pace, and the need to guarantee that pay parity is maintained now throughout this session of Parliament is something I think we should all be able to collectively agree on. I also wanted to touch upon a number of aspects of where I think reform needs to take place, and notably that is in relation, I believe, to the third sector. Because too often the third sector is looked towards as being where we can make cuts. And if we are going to be seeing Scottish Government looking towards where they can make changes and reform the health service, I am concerned that the third sector, as they have always been under the IJBs, will be the first point of contact. And while the Scottish Government talks about the importance of the third sector, quite rightly, for example, the Scottish Huntington's Association provides a nationwide specialist service for families impacted by Huntington's disease, and statutory funding, where provided, is typically only on a 12-month basis via a patchwork of scores of local funders with different reporting requirements who often don't confirm funding for these services until a new financial year has started. This provides complete uncertainty for frontline staff, and more importantly, for vulnerable service users, it is an annual fight to keep the services which they rely on simply to live. So I think we need to look towards reforms such as regional commissioning, which would be a positive solution, I think. And I hope this sort of model is something the Cabinet Secretary can investigate and look towards how that can be taken forward under any reforms the Government are mindful to bring forward. I also think we have a great opportunity, and all of us who will cover the health portfolio over the next 5 years will stand up and talk about the preventative health agenda and how we need to look towards that. I pay tribute to my former colleague Brian Whittle, who used to bring this to the Chamber almost on a weekly basis. But for the government to achieve goals around preventative health, we will need to look towards not just the NHS doing that, but other providers and our whole system, education being at the heart of this, to actually look towards how will we adapt and deploy innovation, including cutting-edge treatments and vaccines, to be seen as a strategic investment rather than a cost. Now, we are lucky as a country to have a pipeline of innovation highly aligned to the needs of our Scottish health system, and there is enormous potential there. I grew up in Perthshire, and I very much welcome Helen McDade to her position as Reform Health spokesperson. I've known Helen for many years and her advocacy around ME shone today in this chamber. But it is important that looking at PRI, when I was young, growing up in Perthshire, it was seen as a university hospital. It was aligned to treatments and actually pushing our health service. Nowadays, it just feels like our health service is trying to keep up. And I hope we can see a change in attitude that once again aligns our health service to our university sector, and to both will help many of the government's outcomes, especially around economic growth as well. So to conclude, and I will be closing for the Conservatives later, so I'll be able to make some comments on members' opening speeches or first speeches, I hope this session can genuinely be one where we can work together to look towards a more sustainable NHS. For all of us, we all rely on our NHS, and we need to make sure it works for those of us who are lucky to serve our constituents here today. Thank you.
We come to the final of the opening speeches, and I call making their first speech David Green.
Thank you, Deputy Presiding Officer, and can I congratulate you on your election and all other members on theirs. Like many new MSPs, I begin by putting on record my thanks to my family, friends and supporters for helping to send me here. The responsibility to now represent everyone across Caithness, Sons and Ross is one that I take seriously. Over the last few years, people have shared with me their stories, their hopes and their worries. Worries that all too often centre on the struggle to access healthcare close to home, particularly for women. It is therefore fitting that I make my first speech in this debate on the NHS. But before I make progress, Deputy Presiding Officer, I wish to pay tribute to my predecessors. Now, John Buchan, the Scottish author, historian and statesman, viewed public service not merely as an administrative duty, but as the worthiest of ambition and the highest, most honourable adventure. I'm honoured to begin that adventure and follow in the liberal traditions of Bob McLennan, John Thurzo, Charles Kennedy and the only other Liberal Democrat MSP to represent this remarkable constituency, Jamie Stone, whose public service is recognised on every doorstep. All of us have a shared common belief that the best decisions are made when local people are empowered to make them. That principle must guide how we reset this Parliament and our politics, and the Liberal Democrats will work constructively with the Government and members from across the Chamber in order to advance that cause. I also pay tribute to Gail Ross, fondly remembered here, particularly as a strong advocate for rural proofing, an issue I intend to champion in the years to come, and to Marie Todd, who I congratulate on her return to government, and I thank her for her warm words to me and to my parents, who I can tell members are in the public gallery this afternoon. Deputy Presiding Officer, I will further put on record my thanks to the members sitting beside me who paved my way to this Parliament. So to Alex Hamilton and Willie Rennie for their boundless leadership, and to my good friend and former boss here at Holyrood, Lee MacArthur, for his many years of mentorship. It is now a privilege to sit alongside them as part of the largest Liberal Democrat group in nearly 20 years. Now, Caithness, Sons and Ross is Scotland's largest constituency. It presents particular challenges: sparsity of population, distance and severe winter weather, all demanding a different approach to the delivery of services. Let me therefore be clear. What works in the Central Belt will not always work in the Highlands, particularly where healthcare is concerned. Deputy Presiding Officer, there is no issue that speaks more to that sense of being forgotten and misunderstood than the downgrading of maternity services in Caithness. Surely all members can agree that it isn't acceptable that mums-to-be in the far north must travel 100-mile-plus journeys in order to give birth at hospital in Inverness. Many families have shared with me their stories. That fear of battling through winter snow, the trauma when emergency transfer plans go wrong, and the anxiety about whether they could ever face having another child under such circumstances. Now, the Cabinet Secretary, who I congratulate on her appointment, will be aware that the situation has attracted international attention, with Caithness Health Action Team taking their case to the UN following a report by the Scottish Human Rights Commission, which found that mothers felt unsafe and terrified. Caithness Health Action Team has led this campaign with real determination, and I am pleased to therefore put on record my thanks to Ron Gunn, Ian Gregory and Maria Aitken for their outstanding leadership. The Cabinet Secretary will also be aware that last November, this Parliament voted for a Liberal Democrat amendment calling for an independent review of maternity services in Caithness. That must mean a chair independent of both NHS Highland and this Scottish Government, and a real commitment to community-led engagement. Now, the Cabinet Secretary has confirmed to the Chamber that she will deliver a statement next week, and I welcome that. However, I urge her today to provide my constituents with a clear commitment on those points and the reassurance that they have waited for far too long. Deputy Presiding Officer, I will finish with this. On Friday, friends and family of the late Jim Wallace will meet in Dunblane to celebrate his life. Jim was an architect of devolution and a politician defined by his ability to build agreement and respect those with whom he disagreed. And in his last contribution to this chamber, he said this: "At a time when politics can be so polarising, surely a common commitment to service, whatever our faith or creed, is something that can unite us all. I hope this Parliament will rise to the challenge that Jim has set us. And for my part, I commit to doing my very best."
We now move on to the open debate, and to make his first speech in this Parliament, David Linden.
Thank you very much, Presiding Officer, and may I start by paying tribute to the previous speaker, Mr Green, and to associate myself with the words that he made in reference to the spirit in which Jim Wallace both legislated and served as a Member of Parliament. It's something that I think is a test for all of us to carry out as we come into this new Parliament. Presiding Officer, in 1995, as a Primary 1 pupil at Milncroft Primary in Cranhill, I remember standing and looking up to the Cranhill Water Tower, which remains the only square water tower in Europe. And if I'd asked me back then if I'd expected that the Scottish Parliament would have its powers over health, education and justice, it would have certainly been a surprise. It would have been even more of a surprise to know that some 30 years on that I would have the privilege, the pleasure and the honour to represent my friends, my family, my neighbours and my constituents, and it is something that I take very seriously, particularly in light of that public service that Mr Green just spoke about. And it's customary in a maiden speech to make reference to your predecessor, and it's the second time that I've given either a maiden speech or, in this case, a first speech. And I find myself in the unusual position now, the invidious position actually, of following a predecessor who started life as an SNP parliamentarian, only for the whip to withdrawn. So I don't know if that means I've got some sort of reverse Midas touch. But in all seriousness, and not to be flippant about it, I do want to pay tribute in particular to John Mason, who For as much as I might have disagreed with certain views that he held, he was without doubt a very committed constituency representative and served the people of East End of Glasgow for the best part of 30 years as a councillor, an MP and an MSP, and you would struggle to find people, particularly in the Garrow Hill area of my constituency, who wouldn't have a nice word to say about John for the commitment that he had. And so on behalf of everybody in this Parliament, I send him every good wish for his retirement. Having just made reference to the rather unusual Cranhill Water Tower, I cannot claim to have the rolling hills and scenic landscapes that Mr Melville and Ms Minto and others would necessarily have. But what I do have, without any doubt, is a real sense of community spirit amongst my constituents, who are absolutely unbeatable and unmatchable in terms of putting their shoulder to the wheel to do things for their community. And there's a real tradition of people working together to help one another. And that's very much the spirit in which I come to this Parliament. And I know that ministers on the front bench in particular, whom I congratulate on their appointment, will also seek to serve Scotland. Ministers who have taken up post or are returning to post in the Health Department have certainly inherited an inbox to deal with, although it would be fair to say that there's been significant progress, particularly in recent months, when we see, for example, a reduction in long waits, when we see that record number of knee and hip operations, and I pay tribute in particular to outgoing ministers in the Health Department who have ensured that. But I know that ministers in the Health Department are aware that there are some challenges for them to deal with, certainly that I plan to talk about. But I think as we come out of the first quarter of a century of devolution and move into the second quarter of a century, the Scottish Parliament can be incredibly proud of the achievements that it's made on health, whether that's been in relation to tackling the issue of smoking with a ban and smoking in public places, whether that's been the introduction of minimum unit pricing. I think that the Scottish Parliament has a great story to tell in terms of its control over health policy, and so that's something that I would seek to build upon. My own constituency, unashamedly, got £67 million from the Scottish Government for the new Parkhead Health Hub that was opened by the First Minister in December. And I think that's a fantastic example of co-location of services, which I think is the model that we now need to move towards, and something I'll come back to in the course of this speech. I welcome very much the Scottish Government's commitment to walk-in GP clinics. I'd certainly be quite keen to see one in East End of Glasgow, and I'm sure the Cabinet Secretary will be not surprised to see me put a path to her door to make the case for that. But there is an issue that I do want to raise in that context, and it's in the spirit that Glasgow is incredibly proud to be a city of sanctuary for asylum seekers and refugees, something that I personally am very proud of. And I know from speaking to quite a lot of doctors locally that they feel that there's a real moral mission to respond to that, but there is undoubtedly a challenge that comes with that, just by nature of the fact that people require extra translation services, so appointments need to be longer. Culturally, more people might come to an appointment. And so in the past, the Health Board has given extra funding in recognition of that high asylum dispersal load. And so I would very much hope that in working with the Scottish Government, that's a point that we can make to the Health Board, so that my local health centre can receive that support as well. There are, of course, challenges that the Government is very well aware of in relation to drug death, and in particular I want to pay tribute to Alison Thulis, who I know did such a huge amount to campaign for the introduction of the Thistle Medical Facility, something that I believe is making a massive difference. And that was a real risk to go out and call for that in the face of populist newspaper writers using inflammatory language. But I think what we're seeing now and what we'll see going forward is that that makes a difference and starts saving lives. And I think the time is now to start looking at rolling that model out. Scotland does have a challenging relationship with alcohol, and that's something that I'll certainly speak more about over the course of this Parliament. But I think that there are some additional things that we need to look at in terms of the uprating of minimum unit pricing. We also need to look at the fact that it does strike me as being frankly ridiculous that there are more labelling requirements in a bottle of orange juice than there is on a can or a bottle of alcohol. And so that's something that I would seek to raise with the Minister. There are a couple of other issues that I want to raise in particular as well, one of which follows on from a point that was referenced by Ms Bailey earlier on, and that relates to the provision of thrombectomy services, something that I would support, moving that to 24/7 support. The reality is the Scottish Government, I think, has already given the best part of £50 million for thrombectomy services, and there's a commitment in the SNP's manifesto for another £25 million. But we need to hold the feet to the fire of health boards to ensure that we roll out that life-saving and life-changing thrombectomy support. And so I hope that I can count on the support of the Cabinet Secretary on that. Another issue that I want to talk about, and I might seem like an unlikely advocate of it, but it is in particular the provision of adaptations for disabled women who are presenting for cervical screenings. Far too few NHS facilities in Scotland have accessible tables when it comes to examination and hoists in place. And so I look forward to working with Ms Kinross O'Neill on that particular issue to ensure that we get what I consider to be a real issue of social justice rectified for women who are disabled. I was very pleased in the SNP manifesto to see a commitment to making use of emerging technology and, for example, things like rolling out digital prescribing. That's something that a number of members of the community nursing team in Shettleston, particularly Mark Morris, have been lobbying me on. And it was something that was also raised in a visit with Community Pharmacy Scotland during the course of the election campaign, where we need to look at how prescribing is done and, frankly, bring it into the 21st century. Which brings me, I guess, to my penultimate point, which is the appointment of one of my other predecessors in the constituency, and that's Mr McKee, who now serves as the MSP for Easterhouse and Springburn. I know that members on the Conservative benches have been fond of giving him a new nickname, but I genuinely think that the appointment of Ivan McKee, whose professional track record on issues of reform is something to be highly respected. But I do find myself, and certainly will question in this Parliament, why we end up in a situation where we've got 14 territorial health boards, 7 special health boards, and I think that these are the kind of conversations that, although difficult, are incumbent upon us as we seek to enter into a spirit of reform and renewal. So, Presiding Officer, as I close, I want to thank you for your forbearance. I want to thank the people of Glasgow, Baillieston and Shettleston for giving me the honour to serve here. And I look forward, over the course of my time in the backbenches, to making a strong contribution and making sure that I stand up for my constituents, just as I did in Westminster. Thank you.
I call on David Smith to be followed by Heather Anderson. David Smith, who has 5 minutes.
Thank you, Deputy Presiding Officer. My speech today is going to be all about social care. I'm going to limit it just due to the scale of what we're talking about. May I start by thanking all the NHS staff, local authority staff and everyone within the third sector for all their hard work over many years, providing care and kindness to the most vulnerable citizens within our society. I'd also like to welcome the Cabinet Secretary for Health and Social Care to her position, and also for recognising the need for reform and renewal and bringing this motion before the Parliament. There is a temptation with motions such as this to make claims such as reform. Is this an acknowledgement of all the government's failures over the years? We really like reform. However, I'm not going to do that. My aim today is not to campaign against the government, but instead is to identify areas within the social care system where we believe there are significant shortfalls, so that collaborative work can begin across all parties for renewal and reform. My experience of the social care system is lived experience. My oldest son has learning difficulties, which has provided me with many opportunities to work with many different organisations and understand how our social care system works, where it doesn't, from an end-user perspective. A few years ago, my partner and I, we also became kinship carers. For those of you that might not be familiar with kinship care and what it is, it's when social services place a child with a family and it's somebody that they already know. It could be a grandparent, an auntie, an uncle, and in our case it was a friend of my daughter's. And these children generally get very, very good results when they go on into further life. Our care-for person has now grown up and she's got a house of her own. These experiences led me to sit on the Health and Social Care Board for Western Bartonshire. And speaking about Health and Social Care Boards is where I really want to start. Every local authority has a Health and Social Care Board. Some members may have sat on these previously, others may not have. And every board should have an unpaid carers rep on the board, and that was my position. Support for these representatives is provided through the Coalition of Carers for Scotland, so I'd like to pay a special thank you to the Coalition for all their efforts over the years in supporting unpaid carers. Our current system for delivering social care is devolved to each local authority individually. What this means is that when we consider reform and we look at the picture across the whole of Scotland, it's a very, very fragmented picture. Some boards deliver some services very well, other services not so well, but we need to acknowledge that when it comes to service delivery, it takes very different forms right across Scotland. We also need to acknowledge that every single health board across Scotland is really struggling to deliver on basic services. Health and Social Care Board meetings have largely become showcases for cuts on top of cuts on top of cuts, and being a member of the board can actually be really kind of depressing sometimes. An example I would like to use when trying to justify all this is the care at home service. So within Western Bartonshire, it's particularly poor at the moment. Allocated time slots for carers have been reduced down to 7 minutes. Across Scotland, many local authorities have reduced their time slots to 10 minutes. Will the Minister agree with me and recognise that these incredibly short visits are completely inappropriate, and instead the Scottish Government must consider legislation to introduce statutory time allocations? I certainly will.
Jackie Bailey.
I'm not opposed to legislation, as the member suggests, but there is a quicker way. Perhaps they would give them sufficient resources to enable them to do their job. Would he agree with that?
David Smith.
I would agree, and that is a point that I'm going to come to. 30 minutes is generally considered by a lot of campaigners as a reasonable amount of time. It was discussed within the Westminster Parliament in 2014. But that's just one example. Many, if not all, local authorities across Scotland are in severe financial difficulty, which is cited as the reason for the decline in many health and social care services. Will the Minister review the formula for health and social care funding with a view to better match the funding to the service demand in local areas? We have many areas across Scotland whereby we have higher proportions of people claiming adult disability payments than other parts of Scotland. And this is due to areas where there's been historically large blocks of industry, like along the Clyde. So, an easy example can be seen from our constituencies around the Clyde area, where adult disability payments are higher due to shipbuilding, and this therefore leads to an increase in funding demand, and these are the areas where the councils are struggling the most. I had the privilege last year to be invited to the Carers Parliament in October, which was held just up the road at the Apex Hotel on the Grassmarket. These events are incredibly beneficial because they bring together unpaid carers from all over Scotland to speak and debate about health and social care issues. There are many people who attended and who bravely shared their stories and experiences. It would be inappropriate for me to reiterate any of them now. However, I will share what many consider to be the broad consensuses of the day. First of all, carers do not want platitudes. They do not want to hear from us that we sympathise and just to tell them that they're doing a great job and to carry on. They've heard this all before and they've been hearing it for far too long. They demand action. Secondly, many believe, as do I, but I was surprised to hear this on the day from other people there, that there is actually enough money in the system, but it's being spent poorly. There were even a few mentions there were even a few people saying that we should introduce some sort of dole-style system to social care to identify where the wasteful spending is. The final point that I took away was that many believe that the problem with the whole system is that for far too long the Scottish Government would introduce policies that sound amazing, however there would never be a plan and there would never be enough money to actually fund the policy. We all have a shared responsibility to get this right, and we are willing to work across all parties to ensure that this happens. Thank you.
We now move on to Heather Anderson, to be followed by Paul McClellan. Heather Anderson, you have 5.5 minutes.
Okay.
Thank you, Presiding Officer. I welcome this opportunity to contribute to this debate on protecting and renewing our NHS, and I congratulate Angela Constance on her appointment as the Cabinet Secretary. We are truly privileged to live in a nation where there is an unequivocal commitment to the continued provision of a publicly owned NHS free at the point of use. Free at the point of use, that's a phrase we use all the time. But it's not until you suddenly need the NHS that you fully realise just how precious that principle is. Over the last year, I've witnessed the NHS firsthand as I've supported a family member through a year of cancer treatment. Like so many others who have been in this position, I have nothing but gratitude and admiration for the consultant, the surgeons, the nursing staff, all of whom have been so intimately involved in our lives over the last 12 months. The care and treatment have been exemplary. Now, I know there are some MSPs in this chamber who might talk glibly about the need to move from a universal rights-based system to an insurance-based system, and I find that terrifying. I doubt I would ever have earned enough money to ensure that we had sufficient insurance to cover the scale of the treatment we have just received. Scans, chemotherapy, community pharmacy, no less than 4 operations, intensive care, acute care and nursing care accompanying every intervention. Every single decision over the last year was based on medical need and patient care, not our ability to pay the bill whenever it was delivered. It was about care, not cost, and that's priceless. Thankfully, the NHS is in safe hands. And as the Cabinet Secretary clarified, the NHS in Scotland under the SNP will never be for sale. And I'm glad to report that the patient is also on the road to recovery. Presiding Officer, our manifesto is packed with commitments to continue to invest and protect the NHS. We're spending £22.5 billion this year. Waiting lists and waiting times are coming down. Operations, GP numbers and staff numbers are going up. Over these first 100 days, I know we will deliver on the many key targets we've listed in our 100-day document. But one of the things I'm most optimistic about is this shift to prevention and community-based care. Public Health Scotland say around 20% of our overall health is determined by access to the NHS. Now, when you need the help from the NHS, it's vital that it's there for you, as I've just testified. But the other 80% of our health is shaped by our employment status, our prospects, our income, our lack of it, our living environment, our neighbourhood, and the decisions we make based on the options we have. We know that from 2010, Westminster austerity caused a decline in life expectancy. We now know we're facing a very big gap between a healthy life expectancy and an unhealthy life expectancy. In Dundee, a woman living in the least deprived communities in Dundee can expect to live 26 years more of a healthy life than a woman living in one of the more deprived communities. This desperately needs our attention. Poverty, insecure work, poor living conditions and hopelessness take their toll, and helping people to improve and maintain their health and prevent illness is equally important. One service doing just that for people with mental ill health in Dundee is Hope Point. It's a 24-hour, 7-day-a-week service provided by Penumbra with support from Dundee Health and Social Care Partnership. No referral is needed. Anyone can drop in, phone or text, and without an appointment, the peer supporters on duty will be there for you. As of yesterday, since opening nearly 3 years ago, over 2,700 people have been supported by this service. They've made over 15,400 contacts with the public. 60% of the contacts they make are between the hours of 6 p.m. and 8 a.m. Being there when people need help is vital, and peer-to-peer support is life-changing. Hope Point provides us with a model which can be replicated across the whole of Scotland, and I'd be absolutely delighted to invite you to Dundee to meet the staff and see the work that they're doing. And finally, I just can't talk about health without acknowledging one of my heroes, should be one of Scotland's huge heroes, John Boyd Orr. the pioneering Scottish scientist and nutritionist who became the first Director General of the UN Food and Agricultural Organisation. Boyd Orr wrote Food, Health and Income back in 1936, 90 years ago. He was working in Glasgow and was shocked by the levels of rickets and poor health in the schools. He then trained as a doctor, and he made the link in that document between poverty, poor diets and ill health. He discovered back then that around 1/3 of the population just couldn't afford a healthy diet. So everything we can do to help people in Scotland get access to good food is important. Boyd Orr always argued that we should prioritise the nutritional needs of women and their children, and we're doing that with all the work we're doing on Best Start grants and Best Start foods. He was instrumental in introducing school milk before Mrs Thatcher took it away, and we're doing our bit in the schools with free school meals. When we think about prevention, it's always worth asking, what would Boyd Orr do? He never lacked ambition. I think he'd have a wry smile when he looks at our aims to link public health and the price of core food essentials. And I'm sure he'd have a thing or two to say at the supermarkets about what the responsibilities are towards public health. So, Presiding Officer, I fully support the motion. I very much look forward to contributing to this debate, and I hope we get more and more innovative on prevention and community support. Thank you.
I call Paul McClellan to be followed by Joe Long. Paul McClellan, who has 5.5 minutes.
Thank you, Presiding Officer. Scotland's NHS is, of course, one of our greatest achievements, and East Lothian is a service that looks after our families every single day. Now, whether that's outstanding care at the East Lothian Community Hospital in Harrington, our local GP practices in North Berwick, Dunbar, Preston Pans, or indeed specialist treatment at the Royal Infirmary, the NHS is a safety net we all rely on. Now, nationally, we all hold the NHS close to our heart, but our experiences, and we've heard this today, are driven by local delivery. East Lothian Community Hospital was fully opened in 2020 at a cost of £70 million, and it replaced the old Roodlands and Herman Flat hospitals. Today I want to speak about the SNP, how the SNP is delivering for East Lothian through 3 clear commitments, and we've heard about that today, about investing, protecting and renewing our NHS. But I also want to talk about the challenges, and we have to admit there are challenges that are out there. One of the challenges for East Lothian is a growing population. So, of course, on delivery investment, the NHS, and we've heard this, is being backed by the SNP government with a record funding of £22.5 million. That includes £17.5 billion for frontline services. Now, that includes £2.3 billion directly for NHS Lothian. There is an issue, of course, of funding for areas of rapid growth, such as the south east of Scotland. I know that's been an issue that's been raised in various forums with NHS Lothian. That's something that I'd like to discuss, obviously, with the Cabinet Secretary when she gets further into her role. And that investment is making a real difference in East Lothian. The East Lothian Community Hospital opened again, as I said, thanks to SNP investment in 2020, but it brought together services from the old Roodlands and Herman Flat hospitals into a state-of-the-art capacity, and it brought 60% more inpatient bed capacity. So one of the key things it does is it delivers better care, and it's closer to home for our growing communities. I have discussed the need locally with the NHS in terms of the need for accident emergency services at East Lothian Community Hospital, and again that's something I'd like to take up with the Cabinet Secretary. We need to ease pressures on acute services by bringing more services from Edinburgh to East Lothian Community Hospital and maximise security. Delayed maximise capacity. Delayed discharge in East Lothian is impacted obviously by the lack of care staff, and the Scottish Government has taken action following the closure of the social care visa route by the UK Government. I know that's an issue in East Lothian. I've spoken to carers, and we do have issues in more remote areas of East Lothian. So again, I think that's something we all need to be concentrating on. And of course, in recruiting more staff. And it's important to mention that Scotland has more GPs per head than anywhere else in the UK, and we're expanding primary care with GP walk-in clinics and additional support for family doctors. And I, of course, like many others, will be supporting and campaigning for a walk-in centre in East Lothian. And of course, in GP surgeries, I mentioned before around about the need for investment into growing communities. We need a new GP practice, for example, in North Berwick, and in a new community of blind dwellers. The Scottish Government has also provided tens of £millions extra to NHS Lothian, specifically to cut waiting times. And we've already seen 11 months of waiting times being cut. But we've also seen other waiting lists falling significantly, with notable reductions in orthopaedics, urology and in general surgery. Secondly, and of course, in protecting in NHS, the SNP will always put the core principles of our NHS first. It must remain comprehensive, it must remain universal, and it must be free at the point of need. And of course, under the SNP, prescriptions, eye tests and personal care remain free. Now, that's benefits that matter enormously to families and older people across East Lothian, and I heard that when I was out campaigning. Now, unlike Reform and Nigel Farage, we reject any move towards privatisation or a two-tier system based on the ability to pay. Whether there's cut or privatised, SNP stands firm. The NHS belongs to the people of Scotland. It's publicly owned, publicly delivered and protected for future generations. And of course, more importantly, we need to renew the NHS. We always need to do that. Investment protection are essential, but we must also renew and reform the NHS to meet the challenges of an ageing population, new technologies and, of course, rising demand. That's why we're shifting the balance of care. And it is about treating more people closer to home through hospital, home and community diagnostics, and increasing and expanding services at a local community hospital. In Harrington, I remember when I was council leader in East Lothian in 2010, we brought a hospital and home initiative to East Lothian then, and it makes a huge difference still now. It's also about harnessing innovation such as the digital booking systems and new ways to access physiotherapy and mental health support. We also need to put prevention at the heart of everything. That's keeping people healthier for longer, so they need hospital care less often. Mental health services are also being expanded and must continue to treat drug and alcoholic harm as a public health issue. Now, in East Lothian, renewal means stronger community services. It means better integration between health and social care. And it's a health service that works for all our coastal towns, growing villages and rural areas. One key thing that I heard back from local communities was the local communities need to be involved in how we deliver and develop services. And of course, challenges remain. Demand is high, pressures are real. But with record investment, falling waiting times in key areas and incredible dedication on NHS staff in East Lothian, we are making steady, serious progress. So let's continue building on the NHS that makes every person in East Lothian proud, one that cares us from cradle to grave and our children and grandchildren can rely on. Thank you.
To make a first speech, Joe Long.
Thank you, Deputy Presiding Officer, and I congratulate you on your election. It's an honour to be giving my first speech in this chamber. I'm grateful for the opportunity to serve, so my first thanks must go to the people of Mid-Scotland and Fife for sending me here. I've lived and worked in the region for many years, and I hope that I can repay their faith through my work in this place to improve their lives. My second thanks go to the Labour members and volunteers who campaigned to have our shared values represented in this Parliament, and I hope I can do them proud too. The region I represent is as diverse as it is large. It contains the heights of Schiehallion and the coastal villages on the Firth of Forth, the south of the Cairngorms National Park and the former mining communities of Fife, agriculture and shipbuilding, the medieval University of St Andrews and the modern campus of Stirling, and of course the region boasts Scotland's ancient capital and its newest city, both of which happen to describe Dunfermline, the place I call home. The region is a microcosm of Scotland in its diversity, but also in the political outcome it gave us last month. MSPs of all stripes were returned to this Parliament, and with that result comes an effective mandate for us to find common cause in improving the lives and opportunities for those we serve. I've been heartened to hear that recognised and repeated across the chamber in the last couple of weeks. I come here from the third sector, working at Scotland's biggest autism charity after many years in health and social care. So it's apt to be making my first speech in this debate, and I'm privileged to be taking on the community care and mental wellbeing portfolios for my party. I'll always be proud of our NHS. I was in my teens when I got my first job as a nursing assistant, supporting adults with learning disabilities in a long-stay NHS hospital. I'm pleased to say that such institutions are no more, and much of my subsequent career in social care was spent supporting adults in their own homes in the community to live more autonomous lives on their own terms. But it would not be true to say the journey is done and that the rights of all people with learning disabilities have been fully realised. We still have far too many people in crisis detained in inappropriate hospital placements, sometimes for years on end. It's been good to see some progress on this recently through the Independent Living Fund, and I hope that this is the Parliament that will see all of those people finally come home. And I hope our health services can be made accessible enough that people with learning disabilities no longer live shorter lives than their peers or continue to die in greater numbers from preventable deaths, a fact that should shame us all. Having campaigned and worked alongside autistic people and families of autistic children in recent years, I also hope that this is the Parliament that we will see neurodevelopmental assessment, diagnosis and community-based support combined in pathways that are truly neuroaffirmative and which do not see people left in limbo on waiting lists for months or years on end. Indeed, it's vital that we improve all of our NHS mental health services for those that are in crisis or in acute need. But we must also recognise that support for our mental well-being is not just about access to treatment when we're unwell and we need it, but those vital elements of any good life: connection, acceptance, belonging, contribution, meaning. Support for these outcomes are often provided by community services run by the charity sector, and these services need to be commissioned by government in a sustainable way that truly values and rewards the workforce. That way, we can properly support all those people that rely on our diverse social care services, whether that's because of lifelong care needs, disabilities, or because of the needs that arise as we get older. If we get that right, we can move away from crisis-driven care and take pressure off our NHS through that proactive support. And I purposely use the word proactive in this context rather than preventative, because whilst I think there is a growing consensus that we won't fix the NHS without fixing social care, I'll always maintain that community services will not perform that role if we treat them like a junior subsidiary of the health service or value them for what they avert. These social care and community-based services need to be recognised as a sector in their own right. At their best, they provide positive outcomes, that connection, that belonging, that quality of life. Parity of esteem is needed if both our NHS and social care are to thrive. I congratulate the Cabinet Secretary and the Minister for Community Care on their appointments, and will happily work to build cross-party consensus on ways forward. In my former workplace, I had the opportunity to engage with the Minister responsible for mental wellbeing, and indeed other members across the House, Tom Arthur and others. We worked on developing plans for new legislation to fulfil the rights of autistic and other neurodivergent people and people with learning disabilities. The bill has yet to be introduced, but I wish to pay tribute to how carefully Marie Todd consulted and listened to stakeholders, particularly those with lived experience. It's now time to act and to deliver on the hopes, the aspirations and the fundamental rights of those communities, and I look forward to working with the Minister and contributing in any way that I can. I wanted to end on a lighter note and give my final thanks to my family, and particularly my wife and daughters, for their tireless support as we figure out a new rhythm to our family life. I had the challenge when elected a few weeks ago of explaining the function of this Parliament to my two young girls. After explaining that members could give their ideas and suggestions, other people would discuss them, and then we vote on what to do, my 8-year-old asked, "So if you stood up and said, 'Let's have a dance party,' and everyone agreed, you'd do it?" At which point my 4-year-old chimed in, "We have some takers." At which point my 4-year-old chimed in, "Or you could call it a disco," which gave me the opportunity to explain that yes, we could then spend several hours debating whether it should be called a dance party or a disco. Now, I'm not sure if the new presiding officer's desire for more spontaneity and dynamism would stretch to my proposing a dance party this afternoon, or how such a motion would be received, but I am heartened by the spirit of openness and goodwill I've experienced here in the past couple of weeks. I hope we can hold on to that in the coming session. I won't resile from holding the Scottish Government to account or for speaking up for those that deserve better. But our communities also deserve a more collaborative and constructive politics in the interests of delivering the change that we all need. Nowhere is that truer than in our health and social care sectors, and I look forward to playing my part.
Bob Doris, to be followed by Stuart McMillan. Bob Doris.
Thank you, Presiding Officer. Can I first of all welcome the Cabinet Secretary and her ministerial team to their place, but also to thank the outgoing Cabinet Secretary Neil Gray for his work over the last few years, in particular in working with me closely to secure newborn baby screening for spinal muscular atrophy, something that I championed and the Scottish Government was able to make happen, something I'm deeply proud of. I've got my list, of course, Presiding Officer, for this Parliament, which does include better care for those living with epidermolysis bullosa. I always say EB because I always trip over the name, but really important. We have to deliver better care for EB sufferers, and we have to look at whole genome sequencing, particularly for cancer patients. Two things I want to return to, not in this speech, but get your asks in early, is what I've learned in this place. So I've done that now. More generally, going to the motion, I welcome the Scottish Government's motion, which recognises and commends the hard-working staff across Scotland's NHS. It places those staff at the heart of the significant progress delivered by our NHS, which of course includes long waits down now 11 months in a row. That's of course not to say there's many challenges. Of course there is, and I know that very well. My wife is a nurse, a critical care nurse, and I hear from her many of those various challenges. We are very well aware of those, and they have to be acted upon. But in this speech, I want to have my contribution on palliative care. and I thank Miles Briggs for his kind words in relation to that. I concur with the work he's done on this, Marie McNair also, but also the outgoing Public Health Minister Jenny Minto for her work in this area. Thank you, Jenny, for everything that you have done. I chaired the cross-party group on palliative end-of-life care in the last Parliament. I hope we get it back up and running in this time. It's very important. To highlight that, a Spice briefing indicated that in 2021, 89% of those dying in Scotland had palliative care needs. There's a huge increase also in those dying with complex needs and multiple conditions, much more complex. Marie Curie pointed out in their report from February this year that a new national analysis shows that almost 1 in 3 people in Scotland die with unmet palliative care needs. That suggests around 18,500 people across Scotland die each year with both significant levels of unaddressed symptom control or concerns about timely access to appropriate care. We must address it. It is estimated that each year around £1.3 billion is spent supporting people in the last year of their life. £1.1 billion of that is spent in hospitals, be that unscheduled visits to A&E, avoidable admissions to acute services, the lack of sustainable support package for those in hospitals to turn back to the community, or secure a care home or a hospice bed. Just some of the examples of how the NHS spends its money in a way that does not meet the best outcomes for those we wish to serve. Given the scale of the challenge, our health and social care sectors must deliver reform and renewal, as today's Scottish Government motion highlights. The challenges may be substantial, but there is cause for optimism. We should not forget that where palliative and end-of-life care is delivered, it is often done to an exceptionally high standard with great care, respect and dignity. That can often get lost within this debate. We also have an excellent hospice network who have, in recent budgets from this place, received additional monies, including to help work towards pay parity with NHS Agenda for Change staff, something I and others in this place have championed for some time. Reform and renewal must be done with Scotland's hospices at its heart, but not just hospices, but a vibrant hospice at home network needs to be nurtured. Our care home staff and our home care workers, they're all fundamental to that network of support required. But regarding hospices, Hospice UK are concerned about challenges in retaining current hospice beds at a time when we need to look at expanding provision, not just maintaining it. The Scottish Government has committed to working with the sector to secure a sustainable hospice network, and I understand there remains an ongoing discussion, a positive discussion between hospices and the Scottish Government about how we work towards that. This will require a longer-term and refreshed funding model for hospices, which is less reliant on charitable donations. A new palliative care strategy was launched in September 2025, and there is much to welcome within it. How and who funds those ambitions and how they are delivered and monitored will be crucial. The strategy's initial delivery plan includes a 24/7 palliative care helpline to give people confidence and support whenever they need advice about palliative care or what to do when someone is ill or dying. It includes the integration of specialist and general palliative care services to get appropriate care more quickly to those who need it, and crucially, ensuring health and social care staff providing general palliative care for people of all ages with life-shortening conditions also have access to 24/7 specialist palliative care advice and support for them to do their job properly on the front line. Presiding Officer, in delivering all these and more, the role and the funding of integrated joint boards will need to be considered carefully. There may be an important role indeed for the National Care Service Advisory Board in helping drive through some of those changes, but change there must be. In the few seconds that I have left, Presiding Officer, I just want to note that in the last Parliament, irrespective of whether people supported Liam MacArthur's end-of-life assisting bill in this place, something he took forward with great dignity, I have to say everyone on all sides of that debate believed we must do better in palliative and end-of-life care. We promised to do it in this Parliament. This Parliament has reconvened. We must deliver for people approaching end of life. Thank you, Presiding Officer.
Stuart McMillan.
Thank you, Presiding Officer. First of all, I welcome you to your role. I also want to welcome the new Cabinet Secretary and ministerial team and pay tribute to those who are no longer within the health brief. I also want to touch upon two MSPs who weren't returned, Jackson Carlow and Jamie Green. Both made hugely important contributions to this Parliament, and I wish them well. as they go on with their lives. I also want to pay tribute to Jeremy Balfour, Ross McCall and Sarah Boyack, who worked with them on the CPA, the Commonwealth Parliamentary Association. I wish them well also. My constituency has increased as a consequence of the boundary changes, and I, as well, has been delighted to once again represent the constituents from Port Glasgow, Greenock, Gourock, Inverkip and Beams Bay. I also look forward to working for my new constituents in Kilmacombe and Quarriers Village, and I want to pay tribute to my campaign team for their excellent work delivering an SNP victory in Inverclyde constituency and also across the country. Moving on to today's debate, and we all know that the NHS is one of the most important issues for the electorate. And in my recent campaign, the four main issues raised with me on the doorsteps were NHS, housing, cost of living and also independence. I know there are challenges within the NHS, but I know there are also many positives. I want to thank the NHS staff for their dedication and also for their hard work that they deliver for every single one of us every single day. Now, the key information which demonstrates how the NHS under this SNP Scottish Government is turning a corner include the long waits down for 11 months in a row, the number of operations carried out up by 7.3%, new outpatient waits over a year have dropped by more than 76%, prescriptions are still free in Scotland, but it's £9.90 in England, and the universal free eye test. These are firm foundations to build our NHS upon, and this Parliament, and they are proof that progress is actually being made, and it was made in the last session to help our health service recover after the COVID-19 pandemic. I'm under no illusion, though, that this progress wasn't easy, and we know it wasn't easy, and we still got more to do. And as we move forward, I welcome the following policies which will play a pivotal role in shaping healthcare delivery, and that's the opening of at least an additional 5 GP walk-in centres, and setting out the locations for the 14, the development of a new national plan for hospital flow, hospital flow to ease pressure on A&E and address delays in discharge, introduce the first heart and lung health MOTs, and submitting a proposal to the UK National Screening Committee on reviewing the age for bowel cancer. I've also improved funding solution for hospices. There are more, but I could list. I just want to list these 5 examples to show that our NHS is changing to help our constituents. I do, however, have some suggestions to help going forward, and like Bob Doris, I'll get my asks in early. Firstly, last week, the NHS Greater Glasgow and Clyde issued a statement saying that they are destroying medicines worth £100,000 per day. I've already spoken to Ivan McKee about this. Now, that's a vast sum of money that's actually been wasted, which I'm sure everyone will acknowledge. In addition to patients, GP practices have a role to play in reducing this. So constituents have told me that they have said to their GP practices that they don't need part of their prescriptions, but this hasn't always been taken forward. So I believe that increased prescription reviews are necessary to help reduce this wastage and save money. Secondly, I was delighted that earlier this year the Scottish Government announced that Port Glasgow Health Centre is to be replaced. Now, this was welcomed by many in the community, but sadly, and also in their own unique way, the local Labour Party turned this positive into a negative. Now, the health centre funding is to be funded through the mutual investment model. And so I'd like to suggest to the Scottish Government to also engage with the Strathclyde Pension Fund, as they are sitting on an absolute wealth of resources. And the replacement...
Will the member take an intervention?
Sure.
Thank you for taking my intervention.
Alex Kerr.
Thank you, Deputy Presiding Officer. Thank you for taking my intervention. I note with the interesting point raised by Stuart McMillan around the potential for pension funds like the Strathclyde Pension Fund to help resource the solutions to the challenges we face, while always ensuring they deliver sound investments for their members. At this point, I must note an interest as a member of the Strathclyde Pension Fund. I was also on the committee until last month, and heard of the direct impact portfolio which targets investments with a local economic or environmental social governance impacts while protecting returns. Would Mr McMillan agree with me that we should encourage such funds and strive to encourage their investment, particularly in devolved areas, come to Scotland in the first instance?
I would remind members that interventions are not speeches and should be short. Thank you very much. Mr McMillan.
Thanks, Presiding Officer. I absolutely agree wholeheartedly with my friend and colleague Alex Kerr, because I think certainly the more investment that comes to Scotland from the Strathclyde Pension Fund, the better, quite frankly. So the replacement of the Port Glasgow Health Centre alone might not actually be enough to make the numbers stack up. So tying in the investment with other projects, such as that the reinvestment into the Inverclyde Royal Hospital may actually make it feasible. The third suggestion is that on mental health delivery, and the Cabinet Secretary touched upon earlier. During my time as a constituency MSP, many constituents have raised the concerns about accessing mental health services, in addition to the growing role that Police Scotland officers are playing in mental health cases when other services aren't available. The impact on Police Scotland, taking officers away from their normal roles, is a cost to them and also to society. And the fact that NHS Greater Glasgow and Clyde is such a vast entity, and considering the Clyde part of it alone and the Christie principles for public sector reform, and advocating for Inverclyde to be considered for a pilot project to have a day mental health facility to help ease those with a mental health need. I believe this would help those in crisis, free up police time and also save money. And finally, during the election campaign, I also heard from constituents about their health journey using the Queen Elizabeth Hospital in Glasgow. Not one person complained about the care that they received, but some, and many did actually ask the question, why, for a routine procedure, why we go in there as compared to getting that service in Inverclyde Royal Hospital. So I think having more of these routine procedures locally as compared to going elsewhere also saves time, certainly for the patient, but also helps the Scottish Ambulance Service, because when ambulances leave Inverclyde, they don't come back for many, many hours because they're stuck at the A&E waiting time, or else they get put onto somewhere else, maybe in Renfrewshire or across the river over towards Clydebank. But I'm conscious of my time, so I will stop there, but there's just a few points I know that certainly would help the health service delivery in Inverclyde. Thank you.
We now have a first speech from Cara McKee.
Thank you, Deputy Presiding Officer, and congratulations on being elected to your post. As this is my first speech here, I would like to start by thanking the people of West Scotland for electing me. I pledge to serve the people in this role, and I recognise the great privilege I now have to speak in this chamber. I've come here from working in a village library, and it was the daily stories of people's struggles in life which made me feel I needed to do something to be the change I wanted to see. So here I am. In the title of this debate, it's acknowledged that the NHS cannot be improved without improving the state of social care. I'm sure that as well as NHS staff, Parliament would like to recognise and commend the social care staff across Scotland's local authorities and the third sector. Long ago in the 1990s in Yorkshire, where I grew up, I worked as a care assistant. This was before minimum wage legislation, which came in the same year as this Parliament. The pay was terrible, but back then I could stay at my mum's. The hours worked well for me and it was a very rewarding job. One day I was chatting to the manager of the home I worked in about the proposals some politicians were making for a minimum wage. At the time, he said that he'd love to pay minimum wage, but he couldn't afford it. But minimum wage was introduced because paying staff a decent wage is not a luxury, it's basic respect. It enables staff to stay. We can't all live at our mums. 30 years later, care workers' pay is still too low. Now a lot more of our care workers are going to people's homes to enable them to stay in a familiar environment, and that's great, but it takes time and requires more expertise than I needed to have as a care assistant in the 90s. We have to ensure that enough time is being factored in for workers to get between homes as well as caring for people when they get there. And this time is scarce at the moment due to understaffing from having had to leave the European Union and because of the work being badly paid. A lack of staff is making this work more stressful, and many care staff who've spoken to me have said that they can't provide the care that folk deserve. We must recognise how things are. It's not good enough just to say that we value these workers. Too often with work like this, work that involves caring for others, work that's mainly done by women, We hear folks say that they don't do it for the money. Well, I'm afraid that being caring does not pay the bills. There are people like my old boss who say that we can't afford fair pay for care workers. We need to recognise that care workers do an extremely demanding job, delivering excellent care, often in difficult circumstances. And we need to ensure that they are getting paid at least £15 per hour, that they have collective bargaining, secure contracts, better terms and conditions. We need to ensure that nurses in social care get paid the same as nurses in the NHS. All this is not just because it's the right way to treat people, but because proper pay and respect for care workers will encourage new workers into the care sector, will save the public purse money, and will improve our NHS by enabling people to move out of hospital beds. Demand on social care services is just going to increase as our population ages. So it's necessary that we work with local authorities, the NHS and the third sector to learn from other models of social care. Models like the Buurtzorg model, developed in the Netherlands, which gives more control and management to care staff and could potentially let us reduce costs without reducing the quality of care. To give us the space to make necessary changes and free up hospital beds, the Scottish Government must provide an immediate funding boost to meet the most pressing needs, including a boost to care workers' pay. Most importantly, we have to recognise that good social care saves us money. Thanks.
Fulton McGregor to be followed by Lloyd Melville. Fulton McGregor.
Thank you, Presiding Officer, and can I welcome you to your role. As this is my first speech since the election, I would like to take the opportunity to thank the people of Coatbridge and Christen for returning me to represent you for the third time, and with around a truly humbling 50% of the vote. I can say with all my heart it is the highest honour to again be given your trust to represent you here. Previous Labour MP Tom Clark, who I've come to know quite well actually, once described the people of Coatbridge and Christen as the salt of the earth, and I would very much concur with those remarks. I, like Tom himself and many others, such as Ricky Burns the boxer, the Kane brothers of Hue and Cry, and the legendary Fran and Anna, all grew up in this constituency and have called it home. Its working class and industrial roots have shaped my values and forged my politics, so just like in the previous 10 years, and regardless of who you voted for, I promise to be a voice for you, who are my constituents, and raise the issues that you ask and that are your priorities. And so on that note, I will be using today's speech to focus on just some of those issues. But before I do that, I would like to commend the Scottish Government under the leadership of the First Minister and the previous Health Secretary for making the progress that has been made in the NHS. Of course, it's far from job done, but just as they promised, good progress has been made. And I'd also like to welcome the new Cabinet Secretary and our Ministers to their role, and I have no doubt they will push this progress to the next level. So turning to the first of the areas I'd like to raise today is the situation with CAMHS. Like I'm sure many others, I have a lot of constituents come to me with concerns about access to CAMHS for their children. NHS Lanarkshire currently have a waiting list of over 4 years. That's 4 years children and young people are waiting to get treatment for often serious mental health issues. Children are also being told they won't get diagnoses until they're an adult. Families who are able to go private for the assessment then can't get access to recommended medication because CAMHS don't have the capacity to take on the case. This is very distressing for our families that we work with. Indeed, my office staff as well report that they are distressed at some of the stories that they are hearing and the lack of service. So the current situation here isn't good enough. We are at the start of a new term. There's a new ministerial team in place, and I implore Marie Todd, who I believe will be taking up this role, to use her position here and her vast experience in government to drive progress in this area, to go beyond just the stats and targets and deliver real change for the families experiencing the delays and lack of service. I know that it won't be easy, Presiding Officer. I know there are staffing issues, I also fully understand that this is not a Scotland-only issue and that all nations in the UK have been struggling in this area since the pandemic especially. And I also believe that CAMHS is not the answer for everyone, and I would urge that there is access to other services at an earlier stage. And I have to say, I'm sorry if this is very direct and just my first speech back, Minister. However, I do fully believe that this situation needs to change. For some of my young constituents, their future is uncertain and in jeopardy because they are not getting the help they need at the time they need it. And I have great faith in the Minister, who I consider a friend, will be the one to take this forward with more progress here. The second area I'd like to raise on behalf of my constituents is that of access to GP services. I'm fortunate to have really good array of GP services across my constituency. However, like all other areas, we get concerns about access to appointments and that ATM rush. Now, the new GP walk-in clinics are going to be a big help with this, and I very much welcome the initiative. However, at present, the nearest announced walk-in GP service will be East Kilbride, some 21 miles from Coatbridge and 24 miles from Steps. And I welcome the news that there's to be one in Shotts as well in North Lanarkshire. However, that is also 24 and 26 miles away respectively from those towns. So I have therefore a suggestion for the Cabinet Secretary, which is a pity she's not here for it, which I know she will also have from me in writing, and that is to say that Gartcosh Development Trust are currently undertaking a community asset transfer of what will soon be the former Gartcosh Primary School to turn it into a community facility. It would be the ideal location for a new walk-in centre with fantastic motorway links, and it would be able to service the whole of North Lanarkshire and possibly the east end of Glasgow as well, which I know David Linden was making a plug for earlier. My constituents have asked me to raise this proposal with the Cabinet Secretary and her team, so I hope that it can be given consideration. I see the Minister nodding there, so that's much appreciated. And, Presiding Officer, my last plea today is in relation to the new Monklands Hospital. The Cabinet Secretary and her team will be aware that the business case put forward by NHS Lanarkshire was not signed off before dissolution of this Parliament. She will also be aware how much the new hospital is needed by my constituents and those of Neil Gray's, whose constituency it will actually be in, and we both visited the site fairly recently. So I do wonder if the Minister is able to say, when she's summing up, if there is any indication yet when that sign-off might take place, because my constituents are obviously quite keen to know. Presiding Officer, I will again conclude by just welcoming the new health team to their roles. I think it's a very exciting period ahead, and just to say that I'm very positive that the recent progress that we've seen in the NHS improvements will be continued under their leadership. Thank you, Presiding Officer.
And for the final speech in the open debate, Lloyd Melville.
Thank you, Deputy Presiding Officer, and let me start by welcoming the Cabinet Secretary's statement and congratulating her, Marie Todd and Alison Thewlis on their new roles. Access to the NHS came up time and again on the doorsteps during the election campaign. Now, people are rightly proud of the NHS and they value it deeply, but when they need care, they want it quickly, locally and without having to fight for an appointment. So that is the test that we must meet. But the future of the NHS will not be secured by hospitals alone. Hospitals matter, waiting times matter, so do operations, diagnostics and emergency care, and I want to thank all of the staff who look after all of us. But as others have touched on, if the NHS reaches people only when illness has become crisis, then it has reached them too late. And that is why prevention must be at the centre of our healthcare strategy, and I welcome the comments that have been made on that. Not just in theory, not just somewhere down the line, but as the practical work of keeping people well, catching illness earlier and protecting the services people rely on. That means stronger general practice, because the first door into the NHS must be easier to reach. It means hospital at home, because for some patients the right care is not in a ward. It means social care that helps people leave hospital when they are ready. And it means GP walk-in centres, because same-day help can stop pressure building into an emergency. And, Presiding Officer, I welcome this Government's manifesto commitment to deliver a walk-in GP centre in Angus. For the people I represent, that means another route to care, less pressure on existing services and support before a problem escalates. Our aim should be simple: the right care in the right place at the right time. And I know from my own experience in Monifieth how much pharmacies already contribute to primary care in the community. When pharmacies are fully used, people can get care quicker closer to home, and often without needing a GP appointment at all. That is not a second-best service. It is the NHS using the skills already present in our communities. Now, Presiding Officer, there are not many moments in public health when a country can say we have the tools to end transmission of a virus. But on HIV, Scotland can say that. Early testing, treatment and PrEP give us a clear route to zero new HIV transmissions. And together, this Parliament could be the one that delivers it. What a legacy that would be. Earlier help matters just as much when someone is struggling with their mental health, as many others have touched on. In my Angus South constituency, the Beacon in Arbroath is already showing what accessible walk-in support for young people can look like. And my colleague Heather Anderson has set out that just over the border in Dundee, Hope Point is delivering vital support to anyone who needs it 24 hours a day. And I have seen firsthand the difference that those staff can make, and I want to thank them for it. When someone is in mental health crisis, they need care, not a system that defaults to a police car or a hospital admission. And as the Cabinet Secretary has said, the introduction of mental health triage cars in Fife, Glasgow, Dundee and Inverness have shown a new approach can work. And our commitment to roll them out across Scotland is exactly the kind of shift we need. Presiding Officer, that same principle should guide our longer-term health strategy. Help earlier, closer to home, before problems become emergencies. But prevention cannot stop at the door of the health service. If poverty makes people ill, then tackling poverty is health policy. If cold homes make people ill, then warm homes are health policy. If poor transport stops someone getting to an appointment, then transport is health policy too. The NHS treats illness, yes, but a healthy society prevents it. That means making sure our bairns do not go hungry, homes are warm, dry and safe, and folk can afford food on the table and a roof over their heads. That is health policy too. None of this removes the need to treat people who are waiting now. People need appointments, operations and emergency care. They need staff with time, buildings that are fit for purpose and systems that help rather than hinder. But if we only respond once people have reached crisis, we will always be asking the NHS to do too much, too late. The serious answer is to move care earlier, support earlier and investment earlier. Not away from the NHS, but into the services and policies that stop people reaching crisis in the first place. That is how together we will renew the promise of the NHS. A public service free at the point of need, strong enough to treat people when they are sick, and bold enough to keep them well throughout their lives. Presiding Officer.
Thank you. We now move to closing speeches, and making their first contribution, can I call Morven May McCallum.
Thank you very much, Deputy Presiding Officer, and congratulations on your appointment. I would like to declare before I progress on my maiden speech that I am a councillor for the Highland Council and I am a volunteer with Lyme Disease UK and Lyme Resource Centre. I would like to thank my predecessors for all their service and the people of the Highlands and Islands for placing their trust in me and sending me to this Parliament. It is an immense privilege to stand here today, not only because I have the honour of representing the incredible people of the Highlands and Islands, where I was born and raised, but because there was once a time when my family and I feared that I wouldn't be alive today. There are many issues that I could speak about when it comes to healthcare in the Highlands and Islands, but today I would like to speak about something which remains largely hidden from view. I would like to speak about chronic illness, and I would like to do so through my own experience. As a teenager, I was bitten by a tick which infected me with Lyme disease. What should have been a few weeks of treatment became years of medical uncertainty. I was repeatedly misdiagnosed, repeatedly denied treatment, and ultimately left to fend for myself as my health condition deteriorated. I spent over 8 years of my life largely housebound and bedbound because of this. While my friends were studying, travelling, building their futures, I was fighting simply to survive each day. It was only through the determination of my family and the financial sacrifices they made that I am here today. Even now, I live with a lifelong illness that affects every aspect of my day. But my story should never have been my story, and nor should it become anybody else's. Yet, all these years on, I constantly hear from people whose experience mirrors my own. The tragedy is that for many people, a few weeks of the correct antibiotics can prevent a lifetime of ill health and disability. Despite the NICE guidelines on Lyme disease coming out in 2018, people are still being refused treatment, prescribed inappropriate antibiotics, and diagnosed too late. The main reason for this is that we still don't have an accurate blood test for Lyme disease. Lyme disease is caused by an extraordinarily complex bacteria, but complexity should never be an excuse for neglect. More worryingly still, these failures are not only harming people's lives, they are costing them. Scott Beattie was a gamekeeper from Rossshire who died at Rigmore Hospital at the age of just 43 after being misdiagnosed and mistreated. What happened to Scott should never have happened, and we owe it to him, to his partner and their 2 children to do better. We owe it to all those people who were left with so little hope by the very system that was built to support them, that they felt they had no choice left to them but to take their own lives. The issue with Lyme disease is widespread, from people being infected walking up Arthur's Seat to people's gardens being so overrun by ticks in the Highlands and Islands that they are scared to let their children play in them. In fact, in a 2024 survey by Lyme Resource Centre, they found that 80% of respondents reported being infected with Lyme disease in the Highlands and Islands, and yet public awareness remains painfully low. The same survey found that 82% said that they, a family member, friend or colleague suspected Lyme disease long before a medical practitioner did. Patients should not have to diagnose themselves, but sadly many people living with chronic illness will recognise the experience of having to self-diagnose. Across Scotland, people with ME, CFS, fibromyalgia, endometriosis, POTS, Ehlers-Danlos syndrome and many other chronic conditions face similar struggles to get diagnosed, access support and treatment. While the conditions may be different, their experiences are often remarkably similar to those who suffer with Lyme disease. Perhaps the most damaging experience of all, though, is not simply the illness itself. It's not being believed. People with chronic illness are often told it's probably just anxiety. Well, you don't look sick. It's all in your head. These are statements that patients should never have to hear. People with chronic illness should not have to sell their homes, spend their pensions, take out huge loans to pay for treatments that should be provided on the NHS. Because behind every misdiagnosis and every waiting list statistic is a human being whose life has been torn apart. I remain proud of our NHS and grateful to the staff who work tirelessly within it. But supporting our NHS also means being honest about where it is failing. We need to have better diagnostics for all chronic illnesses. We need specialist expertise. We need greater awareness among both healthcare professionals and the public. And we need to ensure that patients are listened to when they tell us that they are ill. Because my story should never have been my story, and Scott's story should never have been his. And all across Scotland today, there are people whose stories are still being written, and we have the power to change them. So, I ask this chamber to come together to ensure that no one in Scotland has to fight harder to be believed than they do to get well. And I ask the Cabinet Secretary if she will pay tribute to this in her closing speech and will be open to further discussions with me on this topic. Modern Tang.
I call Miles Briggs.
Thank you, Deputy Presiding Officer. And can I start by congratulating Morven May McCallum on a really excellent first speech to this Parliament. My own father actually contracted Lyme's disease when he was working in forests in Perthshire. And he spent months in Perth Royal Infirmary. And I remember as a kid going to visit him and listening to your speech sent kind of really reminded me of that period, because so many people aren't believed until they are extremely unwell. So I really pay tribute to the member and look forward to seeing what the member will do to campaign on this issue over the course of this Parliament and to make a difference. Deputy Presiding Officer, I wanted to start by returning to my friend and colleague Paul McClelland's contribution, because at the start of this new session of Parliament, and as a Lothian MSP, I have to again raise my concerns, as Paul McClelland has, around the growing gap in health funding which we are seeing on a population basis across our country. And that is no more acute than here in Edinburgh and NHS Lothian. Now, this has been an issue which I have raised consistently in my time as an MSP, but we are seeing a shift in our population in our country, and we need to start acknowledging that as a Parliament and as a government, because if that doesn't go unaddressed, it will be one of the biggest problems facing our health service in the future. I therefore hope that the Cabinet Secretary, as a fellow Lothian MSP, would agree to meet with a cross-party group of MSPs to discuss how we can see a population-based funding mechanism put in place to help address this. That's kind of asking the Cabinet Secretary to meet herself as a Lothian MSP, but I hope it's something she will take forward as well. In 1999, I remember sitting in my modern studies class and being very excited about the election of this new Scottish Parliament and what it could mean for our country. And we used to talk about Scottish solutions to Scottish problems. But 27 years later, I have to ask myself if this Parliament really has been focused on delivering new thinking and fresh ideas for our NHS. And I hope we can all acknowledge that I don't think we can really say it has. Life expectancy in Scotland still remains shocking. 20% of the most and least deprived communities sees the gap between 8 years for women and 11 years for men. Now, Helen McDade spoke about the need for action, and I agree. Too often, our NHS is so good at delivering a process to referral, but not an actual outcome. So we need to see, I think, a change from government strategy after government strategy, but to actually strategies which deliver outcomes. That said, I would highlight two of those strategies which I think ministers should return to, and that is realistic medicine and what matters to me. If we are to actually look towards where patients want to be treated and how they want to be treated, we need to understand that often the NHS overtreats Scots. And that's something I think we need to understand and have a reset around in this session. And we have heard from a number of members today around poor health spend in our health service. Police officers taking people experiencing mental health trauma to A&E to sit with them all day, to then just take them home. And that's where I hope the Cabinet Secretary and the Justice Secretary genuinely are going to work together to end that practice. Stuart McMillan highlighted ambulances tied up at A&E units across our country. And Bob Doris, I think, outlined very well the cost to our health service of not delivering a better hospice and community palliative care system urgently. It is over £1 billion in cost. And I have two stories recently working as an MSP here in Edinburgh where we managed to get a constituent who wanted to return to her roots to die in the Western Isles, to get her back home to have her wishes fulfilled, and another constituent who wanted to die at home here in Edinburgh, and there was a crisis which meant they were blue lighted into hospital and died there when that should have never happened, not the wishes of that individual or their family. So we need to look at how our systems also can change and must change. I very much congratulate and welcome David Green to Parliament. I've known David for many years. He is going to be a great new addition to this Parliament. I met his dad at the Kirking of Parliament, and he has trained his family so well. I've tried to get any gossip or dirt I could out of his father, but he certainly wasn't for telling me. But I very much welcome him to this Parliament. And the point he made in regards to rural proofing, I think that's something we need to focus on. I say that as an Edinburgh and East Lothian MSP, but we need to look towards how often our NHS creates more problems by not thinking about rural communities first as well. Lloyd Melville made some really important points in relation to HIV transmission elimination by 2030, and I'd also highlight the need for us to refocus and return to the Hep C testing and treatment strategies. We were world leading for many years in this area, but we are slipping behind. So I think the strategies we have outlined and where they are being delivered, sometimes on a board-by-board basis instead of a Once for Scotland approach, needs to be revisited. Joe Long is again another great new member. In addition to the Parliament, I worked with him when he was at Scottish Autism, and very much agree with him that the last session, one of my greatest concerns was that the government decided not to take forward the Learning Disabilities, Autism and Neurodivergence bill. His former colleague Pam Duncan-Glancy actually did some really good work around a transitions bill for young people. I think they could complement each other, and I hope the government will make that a priority to bring forward urgently as well. So to conclude, Deputy Presiding Officer, as we start this new session of Parliament, I hope that the Cabinet Secretary is genuinely ready to work with and reach out to all parties to develop a new plan to improve our NHS for this session of Parliament, but also for the future of our NHS. Thank you.
Thank you. Can I call Laura Moody, who is making their first speech?
Thank you, Deputy Presiding Officer, and as this is my first speech, may I congratulate you and the Cabinet Secretary on your recent appointments, and I'd also like to thank the voters of the South of Scotland for placing their trust in me. I can only hope I deserve it. I'm glad to be closing this debate on behalf of the Scottish Greens as someone who believes in the values of our NHS and what they were built on: fairness, dignity and care based on need. And I think everyone in this chamber was moved by Marvin May McCallum's words about what happens when those values are not honoured. I'm really sorry to hear what happened to you. I also speak as a parent, as the sister of an NHS midwife, and as someone who has listened carefully to people across South Scotland about their experiences of healthcare. So I want to begin by saying thank you. Even under enormous pressure, our NHS continues to deliver extraordinary care. Care delivered with professionalism, kindness and compassion. And that experience is shared by many families, and it's why people feel such extraordinary loyalty to their local NHS services. But if we're serious about investing in, protecting and renewing our NHS, we also need to be honest about where it's not working well enough, particularly for rural communities. Last week, I was concerned to learn of an elderly woman in my region who fell while out and about in a local village. Two passers-by separately phoned 999 and were told an ambulance would not be dispatched until the woman had been assessed. One of them took her in her car to the local GP surgery. Thankfully, it was open, and from there she was taken to hospital. She'd broken both an arm and her pelvis. While I understand she is recovering, the incident reminded me of Nye Bevan's statement that no society can legitimately call itself civilised if a sick person is denied medical aid because of a lack of means. And in my region, that lack of means is often shaped by transport. And I thank Lloyd Melville for mentioning in his comments this issue. I regularly hear from people travelling long hours on public transport to attend specialist appointments in Edinburgh or Glasgow. For someone who is unwell, those journeys are exhausting, stressful and at times physically painful. They are not a small inconvenience, they're a real barrier to care. I also welcome the cross-party contributions in this debate on maternity services in Galloway and Caithness especially. As a mum of four, it's also where I've had the most interaction with the NHS. Having had 2 home births when I lived in Glasgow, that opportunity was not available to me when I was pregnant in Galloway with my 4th child. The community midwifery service, while individually excellent, was chronically understaffed. They couldn't guarantee 2 community midwives would be available to support me at home, so I faced a long journey in winter to deliver my youngest in hospital. If we are serious about renewing the NHS and addressing depopulation in our rural communities, our maternity services must be safe, sustainable and accessible, and they must offer women the genuine choice those living in urban areas take for granted. We know the pressure on our NHS is growing. We also know that doing more of the same will not be enough. If we want a health service that is sustainable, we need to invest more in prevention and in community-based care. For rural areas, that really matters. Strong local services can reduce the need for long journeys, and they can help people get care closer to home. But that requires long-term investment, a workforce that is supported and valued, and a willingness to look at bespoke solutions for communities that just don't fit central models. As my Scottish Green colleagues have said, we can't build a sustainable NHS without valuing the people who provide care, wherever that care happens. Social care is a vital, skilled and deeply human form of work, yet too often it comes with low pay, insecure conditions and burnout. To invest in our NHS, we must invest wisely in prevention, in community care and in people. To protect our NHS is to defend its founding principle of care free at the point of need. And to renew our NHS is to recognise that health does not begin in hospitals, but in strong communities, secure lives and a society that cares for one another. That's the Scottish Green vision of healthcare, and it's the future our NHS deserves. Thank you.
I'd like to inform members that we do have some time in hand, and I call Mark Griffin. Thank you.
Thank you, Presiding Officer. Firstly, in my first speech of this new session, I'd like to congratulate Presiding Officer on our election to a role as DPO and welcome the health team to their new briefs as well. I'd also like to thank the people of Central Scotland who have elected me to represent them again, and secondly to thank those who live in the West Lothian part of the new region. I'm grateful for their support and look forward to serving communities across the new region by holding the government to account on the issue that matters most to them and by supporting them well when they need me. But like Miles Briggs, hope that changes, particularly changes in NHS delivery, make that less of a necessity for so many of our constituents. Turn to this debate, I also want to add my thanks to Scotland's NHS and social care staff. Their everyday dedication, professionalism and compassion, often under the most immense pressure, shows Scotland at its very best. I'm grateful as well to all members who have contributed to today's debate. We've heard many thoughtful contributions from across the chamber, but particularly, I think, a whole range of excellent first speeches from new members. Helen McDade raising our considerable experience of ME. David Green rightfully raising maternity services in Caithness. David Linden flagging, I think, a cross-party campaign in support and recognising the need for 24/7 thrombectomy services. Joe Long bringing his long experience of supporting those with a learning disability. Cara McKee raising the crucial issue of pay in social care. Morven May McCallum, a powerful advocate for those with Lyme disease and chronic illnesses, and Laura Moody raising issues of access to care in rural areas, particularly maternity services. Again, I think everybody would agree, fantastic first-time speeches, and I look forward to hearing much more of them through the rest of the session. But, Presiding Officer, it is normal at the start of a parliamentary session for the Government to bring forward a series of debates on the big portfolios, the big issues, and set out their priorities. But what I did find strange, though, was that the Government in its motion had almost nothing to say about their priorities for the NHS, beyond those thanks and recognition for staff, which is absolutely right. I was surprised that it did lack in some of the detail of what their ambition might be. And I think that those NHS and social care staff are looking for more. They're looking for details on how they're going to be supported
doing the job that they love. The public are looking for more. They're looking for more details on how our very most treasured public service is going to be protected and how it's going to be there for them or their family when they need it most, because for lots of people it just hasn't been there recently when they've needed it. Now, it was like the government were going through the motions, knowing that they had to have a debate on the NHS in the first couple of weeks, but seemingly with nothing to say in their motion about how they'll reform and protect it, and so lodged one commending and thanking staff. That's not quite, I think, what staff are looking for, to seem to be treated as a human shield almost in a parliamentary debate. I think they deserve far more than that from this government. It deserves the detail and the ambition for the next 5 years to be set out in that motions. They want the answers to the big issues facing our NHS. Answers for the more than 750,000 people who are waiting for tests and treatment. Answers for people who are struggling to get a GP. Answers for people who have or are worrying if they have cancer, while waiting time standards continue to be missed. Answers for healthcare staff continuing to work under that extraordinary pressure. Because the answer, increasingly for some, is to get into debt and to go private. Unbearable waits with real debilitating pain, stopping people going about their lives, stopping people going to work, stopping people caring for their family. And this week's figures have shown that private healthcare admissions in Scotland are at a record high for the 5th consecutive year, with Scotland seeing the sharpest increase anywhere in the United Kingdom. That's something that is an indicator of the extreme stress the NHS is under, but more importantly, the real stress that people are under, living with conditions that they are desperately waiting for treatment for. Labour founded the NHS on the principle that healthcare should be available to all according to needs. But Scots are being forced to pay out of pocket for healthcare that they've already funded through their own contributions to tax, and that's something that we should be taking really seriously as a huge red light warning flashing on our NHS. But, Presiding Officer, I do want to pay particular tribute to a certain group of staff, and that is the staff of the neonatal and obstetrics units at Wishaw Hospital. Without their skill, their expertise and support, my wife and daughter wouldn't be alive today. But the best way to recognise them is to ensure that they're supported, protected and strengthened. They're for tiny premature babies like Rosa, who are yet to be born. But it's this government which has proposed downgrading that neonatal intensive care unit. Doing that will mean that the smallest and sickest babies will travel further, they'll wait longer for a life-saving services, and that will separate families at the most vulnerable time in their entire lives. The staff at Wishaw have already shown what excellence looks like. Award-winning, life-saving care. But they don't feel supported, they don't feel like their service is being invested in, they have no certainty about their future, and the most crucial point is the staff themselves. They are worried about the premature babies being born in Lanarkshire without that intensive care unit. And I say this in the most collegiate, sensitive way that I can, Presiding Officer. In closing, to the new health team, it's not too late to review and reverse that decision.
I call Victor Curry.
Thank you, Deputy Presiding Officer, and congratulations to the Cabinet Secretary on her appointment. I thank members who have spoken for the first time today for their contributions across a range of valuable areas. I declare an interest as an employee of NHS Lothian. My own path into healthcare was seeded at a very young age. When I was a child, I remember my grandmother, for a period, was regularly visited in her home in the Grassmarket of Edinburgh by a really charming doctor from India with a cut-glass English accent. During these visits, the patience and compassion he showed my grandmother was unlike anything I had seen before. Medical treatments were all well and good, but the effect of these visits in terms of caring human interaction was obvious in my grandmother for days afterwards, a real inspiration to a child of 4 years old. Alas, I took a somewhat scenic route into healthcare, but thanks to the progress made in recruitment and the widening of access to the sector, I was able to enter medical training, albeit at a slightly riper age than most of my professional colleagues. Now, healthcare is an interesting sector to work in because no one that needs it really wants to have to be there. But where it is necessary to make use of our healthcare systems, patients rightfully expect to be listened to, receive a diagnosis, efficacious treatment with a clear rationale, and compassion. But that compassion is becoming harder and harder to deliver. The motion moved today congratulates our workforce. For the resident doctors, nurses, advanced nurse practitioners, porters, lab technicians and scientists who will work overnight tonight, these congratulations will be welcome. But, Deputy Presiding Officer, congratulations are not enough. My colleague, Helen McDade, referred to the lack of investment and cross-speciality interaction when dealing with complex chronic conditions. The lack of prioritisation and urgency in the training of nurse specialists, and all underpinned by management and approval mechanisms that hamper the recruitment and retention of expertise and the delivery of care. Compassion cannot be delivered where there is inconsistency and a lack of resources. Congratulations are not enough. My colleague David Smith highlighted the example of variation in patient contact time depending in one's place according to authority boundary. Not only is this cruel to those in need of help, but one simply cannot, in 7 short minutes, deliver the practical care required, as well as give patients the patience, listening time and understanding to truly deliver compassionate care. Now, I do my NHS colleagues a slight disservice. In these extraordinary circumstances, they do deliver all that is required, as well as offer warmth, kindness and close attention. But giving all you've got for long periods eventually leads to burnout. And this is reflected in staff employment surveys which show 37% of nurses in Scotland are actively planning or thinking of leaving the profession. Deputy Presiding Officer, congratulations are simply not enough. The motion celebrates a decrease in waiting lists over the last 11 months. But how did these waiting lists decrease? More operations? Yes. But supplementing Jackie Bailey's point, last year approximately 54,000 Scots resorted to private providers for their treatment. As stated, a 6% increase on the previous year, and the 5th consecutive year in a row that private healthcare admissions have hit a record high. Now, members in this chamber have inferred that my party wishes to privatise our healthcare system. These statistics show that for a universal healthcare system, the Scottish Government is now effectively doing that themselves. Private medical treatment was once the preserve of the very wealthy, but an increasing number of ordinary Scots are now using their life savings for cataract operations, hip replacements and knee arthroscopies, amongst other treatments. They do this having already fairly paid their taxes to the NHS during their working lives. Now, let reform state this clearly. The founding principles of our NHS, that it remains free at the point of need, available to all, are non-negotiable. Anything else is misinformation. But to protect those very principles, we must be honest. The current centralised structures of the NHS in Scotland are no longer fit for purpose. For decades, our health service has been weighed down by excessive overlapping layers of bureaucracy, pulling vital decision-making away from communities, and we see the consequences every day. Workers stretch their limits while frontline services struggle with persistent implementation gaps that frustrated both patients and staff. But, despite my tone so far, I actually remain really optimistic. The brilliance, compassion and dedication of our NHS workforce and the care sector supporting that remain unparalleled. The system is failing them, not the other way around. Imagine what we could achieve if we finally uncapped their potential by enacting real structural reform. Now, reform's vision is rooted in a fundamental redesign that empowers practitioners at the local level. We must strip away inefficient administrative layers and stop pouring resources into duplicate management structures. Redirect that to the front line and trust our GPs, district nurses and allied health professionals to design and manage patient pathways within their own communities. We also need an integrated health and social care system that truly prioritises prevention, expanding hospital-at-home initiatives and empowering community pharmacies so that families receive care where they need it most, close to home, which I was pleased to hear. Let us be guided by this truth. The NHS does not belong to the politicians. It belongs to the people of Scotland, and it belongs to people who work tirelessly to keep it running. The Royal College of Physicians of Edinburgh and the BMA have called for cross-party consensus on this very issue and radical reform. They know that change is not just possible, but essential. Hope, Deputy Presiding Officer, cannot just be a passive feeling. Hope is a deliberate choice, and it's the decision to look at the challenges facing our health service, accept the need for honest change, and build a system that finally unleashes the brilliance of our healthcare workers. And our motion move today aims to do just that, by first acting as an honest statement of intent, with the first necessary steps to make that happen through the setting up of an independent Scottish Health and Social Care Commission. So let us work collaboratively across this chamber. Let us be bold, let us reform, and let us build an NHS in Scotland that is a beacon of hope, innovation and compassion for generations to come. Thank you.
I call Minister Alison Thulis, who is making her first contribution to the chamber this evening.
Thank you very much, Presiding Officer. I welcome you to your place. I'm absolutely delighted to respond to this today in my new role as Minister for Community Care, one which Jackie Bailey said was challenging, but I am very much up for that challenge. I'm honoured to be speaking on investing, protecting and renewing Scotland's NHS, an issue which touches every family and every community across our country. In my own family, my dad, who was supported to recover from a stroke in his 30s, my mum, who survived breast cancer, my brother, who in a more challenging incident survived a misdiagnosed burst appendix. The NHS touches us all and it is very precious to each and every one of us. I want to pay tribute to Neil Gray and wish him luck in his new role, to Jenny Minto, who did so much in her role as Minister, and to say how delighted I am to be part of this wonderful health team and these fabulous colleagues. I also make my first contribution as the first MSP for Glasgow Central. Most members have paid tribute to their predecessors, but thanks to the efforts of Boundaries Scotland, I find myself with 4 predecessors to mention, so I do appreciate colleagues' indulgence while I do so. Presiding Officer, I have 4 very different pairs of shoes to fill. The first of these is Nicola Sturgeon, former First Minister, but most importantly MSP for the Glasgow South Side part of my constituency. She is a particular inspiration to the shy, geeky, bookish kids like me, as well as to many women across our country. I know from speaking to her former constituents how much they valued the ways in which she supported them, and I've seen firsthand the way she would bring people together to solve problems locally. People in the doors during the election reflected to me on how much her leadership during the pandemic had meant to them personally. A second former First Minister, Hamza Yousaf, MSP for the Glasgow Pollock constituency, represented the Govan part of Glasgow Central. I first met Hamza when I was convener of the YSI, so it feels slightly incongruous that he should have already retired from this place. I have huge respect for both his work in the constituency and for his principled stance in standing up for the people of Gaza, and I can't wait to see what we'll go on to do next. John Mason represented the Glasgow Shettleston part of the Glasgow Central constituency, the part that David Linden doesn't have. It will surprise nobody that John and I disagreed on a few issues over the years, but what has never been in question was his diligent service to his constituents. First elected as a councillor in 1998, as an MP in the groundbreaking 2008 Glasgow East by-election before coming here in 2011. He engaged consistently with faith communities in a way that few others could, and I wish him a long and happy retirement. Last but by no means least, my friend Co-Cab Stewart, who represented the Glasgow Kelvin part of Glasgow Central constituency with vigour over the past 5 years. She will always be the first woman of colour elected to Scotland's Parliament. I know that she had a lot more to give to public life. We shared a constituency office for a while, and I remain saddened that we won't be serving here together. But for the constituency of Glasgow Central, which crosses the Clyde from Calton, Govan, Parkhead to Drummoyne, Yorkhill to Lauriston, I look forward to engaging and to representing every part of that constituency, and it's a considerable honour to do so. I welcome all the other first speeches we've heard this afternoon from Helen McDade, David Green, David Linden, Joe Long, Cara McKee, Morven May McCallum and Laura Moody. All of them are a great credit to their parties, and I hope to work with them closely as we move forward together. And having listened to the debate today, it's clear from members' contributions that there is far more that unites us than divides us when it comes to the future of Scotland's health and care system. I'm committed to working constructively across the Chamber to deliver sustainable, system-wide improvements that meet the needs of people and communities across Scotland now and in the years ahead. As the Cabinet Secretary outlined in her opening remarks, we have made substantial progress over the past year, and our NHS has turned a corner. I have the privilege in this role of being able to look at the challenges we face with fresh eyes, but bringing in my experience as a former MP and councillor, and as others have remarked, bringing in the experience from our casework that we all receive also. In Scotland, our priority will always be to protect our NHS from the creeping privatisation we've seen in England, and to always keep it free at the point of use. In my former role, I have witnessed the devastating impact of cruel Westminster immigration policies on our fellow human beings, particularly those who have not been permitted to carry on their work in the health service and have so much that they could contribute. I have fought against these policies and continue to believe that they are an anathema to Scotland's development and prosperity. The closure of the adult social care visa route for international care workers under Keir Starmer's government has exacerbated the recruitment challenges facing care homes at the length and breadth of Scotland, particularly in our rural communities. We are taking steps here in Scotland to tackle these challenges, including through the introduction of sectoral bargaining, new investment in complex care packages, and our new displaced workers scheme, which we will expand to deliver 45,000 extra hours of care every month. In the absence of having the full range of powers in this Parliament, we need the UK Government to step up and reverse their self-defeating approach to migration. We now have parliaments with reform politicians who are pushing Labour and Keir Starmer further and further to the right. But what we need here in Holyrood is for the majority of MSPs to stand collectively against the disgraceful demonising of migrants and those people who make such a valuable contribution caring for our loved ones. I note that Unison are launching a fair visa campaign in recognition and in defence of the role that these workers play in our health and care system, and I absolutely agree that we cannot afford to lose these skilled workers in Scotland. Colleagues, I say that today we welcome these workers and we thank them for their service. I will never, ever entertain the abhorrent comments we've heard from the Reform Party throughout the election campaign, and indeed in this chamber in recent days. And as Minister, I will always fight for a care system in Scotland that's inclusive, diverse and fit for the Scotland that we want to build. Turning to progress, I'll not repeat the Health Secretary's extensive remarks earlier on that progress, but it is right that we recognise the substantial progress that we've delivered, and the Scottish Government will remain focused on finding the solutions to the pressures and the challenges in the here and now, while we work to deliver the long-term sustainable improvements our services need. For my part, that means building on the important progress made by my predecessors. For example, the approach we've seen to community pharmacies, with more than 5 million consultations delivered. As Lloyd Melville mentioned, that's the right care in the right place at the right time for people, and it can make such a huge difference and keep them away from the A&E front door. In dentistry, 2025 saw the largest rise in domestic dental students in a decade, up 7%. There's more progress also that we can make with HIV eradication, as other members have mentioned, and that is a real goal, that we can get rid of something which in the past seemed quite impossible. We see the progress that we've already made in other vaccinations. As many members in the Chamber mentioned, the role of prevention is absolutely crucial. Paul McLennan, Maggie Chapman, Helen McDade, Lloyd Melville and Heather Anderson all mentioned the importance of prevention, and they all mentioned health inequalities. But I want to take issue with part of what Helen McDade had said, because austerity is more than just pounds and pence coming through in a budget. It's about the impact that it has on people's lives. And I would direct her to read the work by David Walsh and Jerry McCartney, Social Murder, which lays that out in brutal detail, the impact that these cuts have on people's lives and on their well-being. Because people are kept healthier through that prevention. It ensures that we want to ensure that Scotland continues to pave the way in life-changing public health interventions like the baby box and minimum unit pricing. However, that prevention, as Miles Briggs mentioned, is not delivered by the NHS alone. It requires coordinated action across government in health and housing, in education, in transport and business, working in partnership with our public services, with local government and, critically, with the community and voluntary sector. These organisations, many of which I have in my Glasgow Central constituency, are often closest to people's daily lives, providing the trusted, accessible support that underpins good health. And as Heather Anderson pointed out, the historical example of John Boyd Orr is really quite key here. The importance of the price of food to people's health and well-being cannot be underestimated, and that's why we are taking forward these public health proposals on food prices. And as David Linden also mentioned, the Thistle Centre in Glasgow, which I had a small role in encouraging and supporting, gets that support to people who are often considered at the very edges of our society, who don't get the opportunity to engage in those services. And it is helping to keep those people alive and preventing them from failing to get that support that they very much need. I was very pleased to see Joe Long also mentioning the importance of making sure that those with learning disabilities get access to those health services on the same basis and on a basis that is right for them as well, because we cannot continue to have health inequalities for a certain group within society, and I look forward to working with him in his role to progress this issue. We must focus on the care which can be shifted as well into our communities, closer to the people who need it. We are the only part of the UK to provide universal free eye examinations which can identify a range of conditions. We've already built on this with our fantastic community glaucoma service, and we now want to go further with community audiology services delivered locally. And that's all about making it easier for people with hearing loss to get the support that they need without having to go into hospital for an appointment. And as Stuart McMillan pointed out, being able to access these services locally saves time, saves money, it makes things so much easier for constituents. Laura Moody pointed out that these things can be a barrier to care as well, and we should bear that in mind when we think about these services. Shifting the balance of care is also about ensuring people don't remain in hospital longer than they need to. Renewal and reform requires us to work with partners across local governments, the NHS and integration authorities to find those whole system solutions and to drive improvement. There are great examples of partnership working in Scotland, particularly with the third sector and charities, but equally there are stubborn challenges with levels of delayed discharge remaining too high. Presiding officer, each person experiencing a wait to go home from hospital is one too many. But it is also worth remembering that some 97% of people are discharged from hospital without delay. I was very glad to hear Morven May McCallan's very moving speech on her experience with Lyme disease. And misdiagnosis and disbelief are huge issues for many people, still far too many people. And I look forward to working with her on that so that more progress can be made, so that nobody feels left behind by our NHS and care services. I also note the contribution of Miles Briggs and Bob Doris, who both made powerful contributions in the importance of advocacy around palliative care and hospices, and I look forward to working with them to take forward this issue, which matters so much to so many people. And while we have record investment of over £2.3 billion in social care and record funding of almost £15.7 billion for local authorities, our system does need to evolve. As the Cabinet Secretary and indeed members in this chamber have made clear, that cannot be ever to the detriment of our hard-working health and care staff. We are grateful for all that they do, and we are determined to work hand in hand with our workforce and with unions to bring meaningful reform. And I thank Karen McKee and Maggie Chapman for their thoughtful contributions on this matter. Presiding officer, the strength of feeling expressed in the chamber today reflects how deeply we all value our health and care system. It is our most cherished public service, and we must work together to ensure it delivers for the people of Scotland. In summary, the SNP Scottish Government are improving access to treatment with new GP walk-in centres and new heart and lung health MOTs. We're shifting the balance of care towards homes and communities, delivering hospital at home, new community optometry and audiology services. We are redesigning hospital and care services for the future, using digital innovation and delivering Scotland's new app, mycare.scot. We're delivering person-led and compassionate care shaped by individuals, their families and by the workforce. We're embedding prevention by tackling the root causes of health inequalities, and we're strengthening the integration of our services. We are clear about the future we want to build, and urge members across this chamber to support the motion and to work with us on this common ground to keep building a health and social care system that we can all be proud of.
Thank you, Minister. That concludes the debate on investing, protecting and renewing Scotland's NHS. It's time to move on to the next item of business, which is consideration of Business Motion 248 in the name of Jamie Hepburn on behalf of the Parliamentary Bureau, setting out a business programme. I call on Jamie Hepburn to move the motion. Minister. Move, Presiding Officer. The question is that motion 248 be agreed. Are we all agreed? Yes. The motion is agreed. I am minded to accept a motion without notice under Rule 11.2.4 of Standing Orders that decision time be brought forward to now. Minister of Parliamentary Business to move the motion.
Move, Presiding Officer.
The question is that decision time be brought forward to now. Are we all agreed? We are all agreed. We now move to decision time, and there are 4 questions to be put as a result of today's business. The first question is Amendment 228.1 in the name of Helen McDade, which seeks to amend Motion 228 in the name of Angela Constance on investing, protecting and renewing Scotland's NHS. Be agreed. Are we all agreed? No. The Parliament is not agreed. Therefore, we move to a vote. There will be a short suspension to allow members to access the digital voting system. Before we start proceedings, can I ask any members who have difficulty voting or accessing the voting system, please press the point of order button. We'll now restart proceedings. The question is that Amendment 228.1 in the name of Helen McDade. Please, members cast their vote now. Voting is closed. Malcolm Offord, point of order.
To vote for the motion.
That vote is recorded. Thank you. The result of the vote on Amendment 228.1 in the name of Helen McDade is yes, 27, no, 98. The amendment is not agreed. The question, therefore, is that Amendment 228.4 in the name of Jackie Bailey, which seeks to amend Motion 228 in the name of Angela Constance, be agreed. Are we all agreed? No. Members are not agreed. We will move to a vote. Members should cast their votes now. Voting is closed. The result of the vote on amendment number 228.4 in the name of Jackie Bailey is as follows. Yes, 54. No, 55. There are 15 abstentions. The amendment is therefore not agreed to. The next question is amendment 228.2 in the name of Maggie Chapman, which seeks to amend motion 228 in the name of Angela Constance. Be agreed. Are we all agreed? No. The amendment is not agreed. Therefore, we will move to a vote. Members should cast their votes now. Voting is closed. Point of order, call Merrick.
I couldn't. It didn't record my vote. I would have voted no.
Your vote has been recorded. Thank you. Amanda Lindsay, point of order.
Apologies, I couldn't connect. I would have voted no.
Thank you. Your vote is recorded. The result of the vote on amendment number 228.2 is yes 41, no 82. There is one abstention. The amendment is not agreed. The final question, therefore, is that motion 228 in the name of Angela Constance on investing, protecting and renewing Scotland's NHS be agreed. Are we all agreed? Yes. We are not agreed. Please vote now. Voting is closed. Point of order, David Green.
Sorry, I couldn't work it on the system, but I'd have voted no.
Your vote is recorded. Thank you. Colette Stevenson.
My app appears to have frozen. I would have voted yes.
Thank you. Your vote is recorded. The result of the vote on motion 2 to 8 in the name of Angela Constance is yes, 99, no, 6. There were 18 abstentions. The motion is therefore agreed. That concludes decision time. I therefore close this meeting of Parliament.